today with us here at MJB Management and Integrated Services. You're welcome to Certified Pharmacy Technician course. Please, I don't know. I want to know who is using Samsung SMA71. Please, who is using Samsung SMA71?
I'm wondering, the person should let us know because there are actually three people here. It's either Pat, Madam Pat, or Nenna, or Martha Ijoma. So please, let's know you so that we can move. Could it be network from the end of the person or the person muted? At least let's know who you are.
Let me do like let me ask her to unmute. Let me ask her to unmute and see.
Okay.
The person is not responding. I don't know. The person is not responding. So
And I
I don't
can't
know.
see.
Let's just wait for the rest
Okay,
to
let's
join.
wait.
The person is not responding. Let's wait.
Thank
He's not
you.
responding.
We wanted to know who is actually that person. Okay, thank you for responding. You're welcome.
Hello, sorry, please. I dropped the call. I'm on the course. Okay.
Okay, I don't know why we are not having others join us. Okay, good evening, Madam Pat.
Good evening.
It's nice to have you here. We're supposed to be three, and I haven't seen the others. I'm wondering what's happening, but I want to thank you specially because you've been very patient from day one, even when we had to postpone, and it was like we weren't actually going to carry out this course at the end of the day, but you were quite understanding. So thank you very much for that.
You're
Likewise,
welcome.
yeah, we are the very first person to be here. I don't know, we're supposed to be three. And we had already, MJB Management and Integrated Services already made up That's even if it's just you, we're going to take the program. So, but thank God we had two others pay afterwards, like I told you. So we're supposed to be three, and I don't know why they're not here. But I cannot delay you or please them to your own detriment, because we knew we're supposed to start by 5. So we are going to just delve straight into it. Earlier before you came, one person joined us and then went out again before you came. So you're welcome. So we are actually going to have the Certified Pharmacy Technician program, like you paid for, like MJB. Okay. I'm finding out. Okay, I was just looking at so one person is saying she has a challenge to actually join, but we have
Yes,
this.
I saw it too. I saw it too. I wanted to tell you that it's like you help somebody saying that is having challenge joining.
Yes, I have been trying to join but not getting in. Please try to restart your phone. Okay. I don't know why, because it's the same link. I guess it's the same you joined. It's the same link we actually used. I don't know why, but someone is attending to
Okay.
her. So maybe
Let's wait for her now.
Your indulgence, please. Let's wait for her.
Yes, let's wait for her, yes.
Thank you.
Welcome.
how we keep to our words. Okay, without wasting time, because we've given this already 5:30, let's just go straight ahead. I want to, okay, I can see Mrs. Nenos. Mrs. Nena Chinwe, good evening. Mrs. Nena Chinwe, good evening.
Good evening, sir. Good evening, sir. Sorry, I was on transit. I just settled down now.
Hello, Mrs. Nena Chinwe, good evening.
I'm here. I can hear you. Can you hear
Okay,
me?
maybe it's network.
I
All
can
right,
hear you.
I want to
hear you.
Good evening,
Okay,
ma.
can you hear me? Yes. I was on transit. I just settled down now, so I logged in. Sorry.
Yes, I.
Yeah, welcome.
Oh,
Thank you.
okay,
Thank
okay. All right, you are welcome. All right, without wasting time, I want to introduce to us. Some of us we know her, and some of us this is our first time of getting to know her. Today, we have the privilege of welcoming a highly qualified and experienced facilitator for our Certified Pharmacy Technician course CPT. This individual brings a wealth of knowledge and enthusiasm to the table, ready to share her expertise and passion for pharmacy. With her guidance, we will embark on a journey of learning, growing, and pursuing our goals. Let's give a warm welcome to our talented and brilliant facilitator, Dr. Dorothy Kingsley Etugudo. Good evening, Doctor. Mrs. Dorothy Kingsley Etugudo, you're welcome, ma.
Thank you so much, MJB Management and Integrated Services, for that warm welcome. It's nice to be here once again. I'm always excited whenever I am called upon to take any training, any health-related training for MJB Management. So it's a pleasure to be here. Thank you so much. I want to thank the participants, Madam Nena Chinwe, and Mrs. Pats too. Mrs. Ndidi, I don't know. Madam Pats, please, what does the Pat stand for? Is it Patricia? Am I correct? Okay. Well, I don't know. Maybe I cannot hear her. So I guess maybe it's network or something from that end. So today, we are going to be delving into what we have without wasting time. It's nice to have everybody here, and I'm so excited to have you here again, Madam Nena. Can you hear me?
Yes, I can hear you, ma. Yeah,
Okay,
thank
so,
you. It's a pleasure.
so when I saw, thank you too. When I saw the payment and I saw Nena was asking, I said, wow, it's going to be another it's going to be a beautiful experience for me again to have Nena.
Yes,
I was really looking to have you in other courses as well, but thank you for joining us here. Okay, so
yeah.
now let's get to what we have. Without wasting time, we are going to be running like this. Already we've spent 30 minutes. We are 30 minutes behind schedule, and we'll just see how to go about it. I want to first and foremost, so that I know how I talk about the medical terminologies that we have here, because we have a lot. So please, I would like to know, Madam Nena, I would like to ask you, are you in the pharmaceutical field already, or are you just planning to get into it? The reason I'm asking is that there are very heavy terminologies in this, so I would know how to, when I get there, I know how to go about it. So I want to ask, do you have any pharmaceutical knowledge, or you are just moving into that field?
No, I do not have any pharmaceutical knowledge, except maybe the drugs we already know that are popular. That's all I know. I don't have any pharmaceutical background whatsoever, sir.
Okay, yeah, welcome. I'm glad to have people delve into the health sector. We just need, the more people we have there, the better it would be for us, and the more dedicated people like you will be glad to have you. So, Madam Pat. Hello, Madam Pat Ndidi. Can you hear me? Madam Pat was here all along, asking us to hold on for the other two participants to join us. But now I wonder if she's still there. Okay, but however, I have decided to share my screen. We are going to be looking at all the modules. We are going to be taking the first 3 modules today, which is the Introduction to Pharmacy Practice, We are also going to be looking at pharmacology and as well as pharmaceutical calculations. So today, let's try to take our minds back. Those of us that used to run away from mathematics, if we have people here, we used to run away from calculations. Actually, I used to run away from calculations while I was in school, you know. And again, it was because of the teacher that was actually teaching me mathematics. So the teacher did not know how to use the playway method, like how to relate with us. So whenever it's time for mathematics, we always look for, I personally always look for one excuse or the other. Little did I know that I'll come face to face with mathematics that I was actually going to work hand in hand with mathematics, let me say so. So we are going to have to see some of calculations that we learned in school, how to do a form of some calculations on the platform. So I will advise that maybe to be on the safe side, so that we will not have to stand up, we can just get a writing material and maybe a pen handy in case you may need to do one swift calculation as we progress. So we are going to be looking at the 3 modules: Introduction to Pharmacy Practice, and Pharmacology and Pharmaceutical Calculations, by the grace of God today. We pray that network would be friendly, that we will just move as we go. So what is actually this? The reason I am talking about this. Okay, take for instance, you walk into a pharmacy, or just imagine, let's just imagine, paint a picture of what I am trying to say in our heads. You walk into a pharmacy and then you see a very bustling and lively environment where people are not just filling prescriptions, but they are also providing vital health information. Maybe you walk into a pharmacy, a big pharmacy where you have a particular section, they are giving information, educating people as regards their drugs, how to take their drugs and all that. And you have another part filling prescriptions. Now, that's where you come in. That's where you, as a pharmacy technician, that is where you really come in and get to work. So, overly, these 4 days, we are going to explore how you can become an essential part of this dynamic field, of this pharmacy field. With my years of experience, over 15 counting years of experience in the health, I have seen firsthand how pharmacy technicians transform lives. How do they? You see, in their own little way, you may think that what you are actually doing, the step you have actually taken, maybe, but on the long run, you will observe that anybody that has anything to do with human life, you are actually doing a very, very crucial, you're performing a crucial role. If you have anything to do, whether dispensing drugs, whether actually taking care of the patients, whether treating them, whether just giving them the emotional support, whichever way you are in the health setting, you are actually doing a crucial job. So whether it's helping someone ensuring that prescriptions are filled accurately, your role is very, very important, like I said. Now, of the last time you needed advice on a medication, sometimes you may need to take some medication, something you may be having one or the other, and you would need a pharmacist, you would need the help of someone to tell you, to give you advice concerning a particular drug. Now, that's that feeling of trust, that feeling of support, that's what we are going to build upon together in the course of taking this course. I just want you to have it in the back of your mind, because they need the trust. They need the trust, they need that support, and that's what you are there to give. So let's move to what we have. Now, we are going to, these are the objectives for the class. I would permit me to use the slideshow so that it will be big enough for us all to good, so we can see and understand that as we progress. So we are going to look at these objectives. At the end of the 4 days that we have, we are going to see how to enhance understanding of pharmacology. We are going to see how to encourage professional development. If you want to advance in this particular field, how are you going to go about it? We are going to see how we can foster clinical knowledge that is necessary for your patients, and then to help them, to give them that therapy that they need to actually come out better, to give us good health, positive outcomes. So Good. So let's look at this pharmacology. Let's just take a look at it. Now, pharmacy practice, what does it entail? As a pharmacist, what are you expected to do? Today, because we don't have too many people, so me, I would not like to do the talking all through. I would like to just allow you to do some form of talking so that I can also hear from you. I would not like to do the talking myself all through. So at this point, when we talk about pharmacists, when we talk about pharmacy practice, what do you think it is about? What do you think it is about? I would love to hear Madam Pat's voice, because I wouldn't throw all my questions to Madam Nnenna. I wouldn't want to throw all my questions to her. I don't know if Madam Pat can hear me. So, hello, Madam Pat, hear me, because I'd like to direct some of the to you and ask for your contributions too. Can you hear me? Okay, so yes, Madam Nnenna, I just asked the question. Maybe for now you be the one that will be giving me the responses. So pharmacy practice entails, what is it about? Pharmacy, pharmacists, the pharmaceutical industry, everything put together. What do you think it is about? Can you, Nnenna? Thank you. Or what does it tell you? What is it about?
Okay.
Yes, I can. Very clear.
Okay, I was saying that it's a layman's view, the one that I know you should, from my own understanding, is a dispensing of drugs, of medications prescribed by maybe the medical doctor.
That's beautiful. Nnenna, you know, when you say man's angle, your doesn't really tell me that you're a layman. Your response.
Really?
So your response tells me that you have had interactions with drugs or people that sell drugs or all that. So thank you for that. That's not really a layman's answer. Thank you for that meaning. So practically the A to Z of it, it talks about dispensing drugs. It talks about how best you go about serving the people that actually need these medications, what these medications are about, or how it will do for the body at the end of the day. That's the A to Z of what we are going to be looking at. Now, like you can see, this is a beautiful and big pharmacy where we have different drugs. You can see the pharmacy technician with the pharmacist. You can see from this picture. So this is a pharmacy, a big one. We have little, we have chemists, we have patent drug stores and so on. But for this, we are going to be looking at pharmacies. That's big pharmacies where they deal with drugs and all that. Okay, because that's where you find a licensed pharmacist. All right, so now, like we have already seen here, pharmacy practice is just the A to Z. It just talks about dispensing drugs. It talks about how drugs can be dispensed, how you can prepare, how these drugs are prepared, and the proper use of the medication ensures safe and effective patients. Now, why this particular important is because, like I said, it deals with human life. It deals with illness, how to cure people. It deals with a whole lot of things. So just one little mistake can cause a lot of damage. Take, for instance, there's a prescription for someone to take Panadol, and you give the person maybe another painkiller without taking into consideration the person's medical history, maybe the person's drug regimen. That's what I mean by drug regimen, what the person, the types of drugs the person is supposed to take and the ones the person is not supposed to take based on one illness, underlying illness or the other. So over time, the issue of drugs has evolved because of technology. In the olden days, much earlier, we used to deal with herbs. If something just happens, maybe we try to have traditional medicine, you know, before technology actually metamorphosed. We came face to face with the technology age, where most of these our methods of us doing things had to change. We now evolved with technology. Medicine and technology now evolved. So as a pharmacy technician, you have a very important role to play. You may not be a pharmacist, but you work hand in hand. It's like I tell people in the hospitals, the people that interface with the patients, when a patient gets to the pharmacy, maybe with a drug prescription, it's not all the time they get to see the pharmacist. It's not all the time they get that support, maybe from the pharmacist. The first point of call is they see you, the pharmacy technician, before they get to the pharmacist in most cases. So that is to say that you have a crucial role to play. You have to ensure that you give them the right drugs, you take note of their medical regimen, maybe their medical history, and then it is having found out all these things and put them together that you can then reach out to the pharmacist based on your own processes, on your own procedure. And don't forget that the pharmacy technician also does the administrative aspect of it. So whatever you document is what would stand, is what will the pharmacist will eventually see to act upon. So pharmacy technicians play a very crucial role in medicine as a whole, okay, or in the health field. Now, pharmacy practice, like we already talked about, is just simply preparing, dispensing, selling medications, and then providing related services to patients. Not only just providing those services, but making sure that it is safe and it is delivered effectively. Those medications are actually delivered accordingly as to how it should be, and they are taken correctly. All these things put together is the pharmacy practice, not just the selling of the drugs. It's a whole lot. It entails a whole lot. So, but the most important thing is that if we know that we are dealing with people that are vulnerable, people that actually need to trust you, people that actually need your support, because they can tell you whatever illness they have, they can talk to you in confidence, and they know that they expect that you are knowledgeable to be able to decipher and advise them as to what to do based on the prescription that they have at hand. So this is very important. Like you can see what the pharmacist is doing right there. You can see the other lady trying to put together drugs, looking at the prescription, and so on and so forth. So that is, we'll get to the duties of a pharmacy technician much later. So let me not overflock it. Now we have the scope of practice. Now, like I said, that pharmacy practice has moved with technology, you know, and the advancements in the healthcare system with technology. We have different, so there are different areas. Medication dispensing, like we talked about, it is the duty of a pharmacist to dispense drugs, to ensure that you fill prescriptions. Maybe in the hospitals, we'll get to see the different settings where we have pharmacies. It could be in the hospital, different settings. We are going to get to that today, hopefully. Then compounding medications, how to put together these medications. This is what the right dose, the right mixture, and everything. It is for the pharmacist. That is entirely in the pharmacist's scope to do that. Now, patient counseling too. Providing patients with information about their medications. This is another very important thing. It is very wrong for someone to walk into a pharmacy with a prescription or maybe with a paper, and then you as a pharmacy technician or even the pharmacist does not explain, okay, this drug is this, okay, I can see you're supposed to take it this number of times, and these are the side effects. When you take it, you shouldn't be driving. Maybe the side effect that comes with this drug, you can be drowsy or you can feel dizzy. So when you take this drug, make sure you are not driving, make sure you are in a relaxed position, and it is important that they know the proper usage of this drug. So one of the things that's one of the areas of pharmacy practice is counseling patients, talking to them. What are the challenges? What is the illness? What are the okay, these drugs, how are you expected to take it? Or you've taken it before. How did you feel when you took it before? These are some things that you do. How are you going to use it? Even when you put together the drugs, you need to properly advise as to how this patient will take the drug. Regardless of the fact that that patient has communicated with a doctor, maybe has talked with the doctor and prescription is from the doctor or from the nurse, you still have your own role to play. Patients counseling, very important. Very, very important for you to succeed in this business called pharmacy, in the pharmaceutical setting. You have to have that ability to counsel your patients. Walk a mile into their lives, know why they are taking the drugs, explain to them how they should take it, the side effects, everything. It's very important for you to let your patients actually know what it entails, what any drug entails. Like I used to tell people, I think I've said that severally when I have other health-related courses, I tell people that it is wrong for you to take a medication without knowing the side effects, without knowing the name. It is that bad. There are some patients that actually take medications. You ask them the name. For instance, maybe they have gone to see a doctor, they have the doctor's prescription, they've seen the pharmacist have given them the drugs and all that, and maybe they get back and then you ask, oh, you went to the hospital today, you said, oh, I was given drugs for this, and the person asks you, okay, which drug were you given? There are people that wouldn't even know the names of the drugs that they have taken. It's that bad. So you see that you still have to educate them. They need to know the drugs. They need to have informed decisions. They need to know that when I take it, this is what will happen. They need to know that I'm taking it because of this particular illness or this challenge that I have. I'm to take it this number of times. I'm to take it like this. Is it going to be oral? Is it going to be intravenous? All these things are things that you really need to explain as a pharmacist to your patient. You can see that picture we have there. Very, very cordial. You can see the way they are talking. Obviously, the pharmacy technician is trying to explain to the patients the drugs that she's supposed to take, and perhaps giving her details as to what she needs to know. So we also have the sterile compounding. That's another duty of a pharmacy technician or pharmacists or the pharmaceutical practice in general. You have to prepare sterile medications. What do we mean by preparing, especially those intravenous ones? Because intravenous injections, sterile drugs like that are very, very easy to get contaminated. So they are always prepared, they're always compounded, they're always put together in a controlled environment that is rid of infection or germs. So you see, the way you treat just an ordinary medication is not the way you treat intravenous, because intravenous medicines go directly into the blood. They go right into your body, into the blood. So sterile compounding, where you keep those drugs that has got to do with the veins, you inject them through the veins, or injections especially, should be in a controlled environment, a controlled space. Not just anybody goes in there, and the place is sterile, as in the place is how do I put it? Is free from infections, free from germs. Very, very important. We also have the pharmaceutical care, to providing comprehensive care, including monitoring the medication use and addressing their medication needs. Excuse me, I have a little cough. So, addressing their medication-related needs, very, very important. So we also have the regulatory compliance too. The pharmaceutical setting is just like is anything medical is highly regulated. Is filled with, you have to be compliant in anything you do, regulated heavily. So ensure that pharmacy practices adhere to all the laws. There are laws, there are regulations that govern drug prescriptions. So that's to say, you don't just prescribe drugs anyhow. They're in the health field. There are laws, there are regulations that govern drugs. There are substances that are controlled, and then there is privacy of the patient. There are a whole lot. On no account should you divulge a personal and information, a patient's health information to a third party, to anybody that is not involved in that person's line of care or involved in the healthcare team. It is wrong. So these are some of the laws that guide that particular business. You don't sell drugs for someone and then maybe someone else wants to know, oh, that drugs you just, that medicine or that drugs that you just sent, what is it for? What did the person get the drug for and all that? No, you don't have any right to divulge any information, except, that's why I say there are laws, except to some people that are actually involved in the care or to the force, in case maybe if there is an emergency or if there's an issue, good, they can get back. That one is legal. So, but any other person, you don't have the rights to divulge any information. Equally, public health too, information about medication safety and prevention of diseases, very important. That is also part of your duty as a pharmacist. Enlightenment, awareness, creating awareness. Like when we used to have the that era of COVID-19, that people were like, some people will not use their nose mask, will not use their face mask and all those things. That is when the the practitioners, the healthcare workers, public health officers sprang into work, to ensure that they sensitize people, they create awareness, because you are automatically a part of the health team. So you have to work hand in hand to ensure that as much as possible, these diseases are, airborne diseases like the COVID that we had will be nipped in the bud or will really, really, really reduce when people become compliant. So these are some of the things that we are expected to do as a pharmacy technician. Okay, we also have the history, like we said, the history of a pharmacy practice did not just start today, spans thousands of years, reflecting the evolution of medicine and the role of pharmacists in the society. We cannot just overemphasize, we can't talk about it because it is very important. Pharmacists deal with drugs, and they have to be very careful because a slight mistake or the slightest mistake can end a person's life. Anything you do in a single act of carelessness can go a long way in harming, a whole lot of people. So this is very important for us to take note of. Please, are we together? I don't know if I'm just talking to Nena alone. I don't know if you can hear me. Nena, can you hear me?
I can hear you, ma.
Okay.
I can hear you.
Pat, can you hear me? I don't understand again for Pat. So Pat was here. She was the very first person to be here. She was the very first person to be here. So I'm wondering what could be the problem.
Hello, my dear.
Okay, so I don't know what's happening to Pat, but however, maybe she's in a meeting or something. So like I was saying, medicine did not just start today. It started from far back, thousands of years ago. And as we kept improving, we kept improving and doing better as time progressed. So let's see what we have got on the next slide. Okay. Evolution of pharmacy technician. How did it come into being? Now, up until now, if you are very, very observant, you will understand that, or you must have noticed that this pharmacy technician thing is more like a new profession. People are delving into it now. People are really delving into it. Why? Because there is need because of how healthcare has cut across all facets now. There is the need for duties to be spread out or duties to be assigned, so that many people can come into the healthcare system and they'll do more of this work to ensure that we have a swift process. We have hitch-free processes as we dispense drugs. So pharmacy technicians work in different settings, like you can see, different settings. with different responsibilities. They interact with patients. They ensure that patients actually get the right medication. And because of that, it is very, very important that pharmacy technicians understand the different settings that we have, that we find pharmacists there, because in these different settings, you get to see different environments depending on, just like I told you, that they are patent drugstores. Then we have the pharmacies, the big, large pharmacies. We have the chemists. We have, smaller, then we have the large pharmacies. So it depends on the setting you work. But on the whole, pharmacy technicians carry out the same duty. They do this. They have the same responsibilities. They do the same thing. So we are going to look at some of those settings that we actually have pharmacy technicians. That's what we are going to see now. Now we have the community pharmacists. What do they do? Or where can we term community pharmacies? Now we have independent pharmacies that are, locally owned and operated, that offer different services, locally owned and operated in local settings. They do a lot of work. They fill in prescriptions. They give over-the-counter medications and health and wellness products. Community pharmacies, like you can see that picture there, where members of the community, they just go in, maybe in a local environment, and that particular pharmacy, or those pharmacies, are generally for the community. Now we have the chain pharmacies too, that operate multiple stores across a region or country. They have different stores. Sometimes they are located in grocery stores. Sometimes you get to see pharmacies, maybe big, large stores. You just see a particular section of it is coined out to be a pharmacy, where they sell drugs, they give over-the-counter prescriptions, and other healthcare services. They do it in big grocery stores. Some of us must have come across that. So we have that. We have the chain pharmacies. We have the grocery store pharmacies. Like I said, where we have it with other things being sold, other materials or other things being sold there, but they just reserve a place, is part of it, for to use as the pharmacist, pharmacy where people come to get drugs. So we also have hospital pharmacies too. In the hospitals, inpatient pharmacies, where patients that are within the hospital may be serving the needs of hospitalized patients. In every hospital they'll give you the drug prescription, or they send it over to the pharmacist. You get there and then you get your drug. So those are the aspects that pharmacy technicians can actually fit in. You help with the drug, dispensing the drugs, educating the patients, telling them what exactly to do, and so on and so forth. These are things that are very, very important. Now, outpatient pharmacies too, that are located within or adjacent to the hospitals. Now, there are some hospitals, like I have some even near my house. I have two, that they have their they have the hospital. Then you go out of the hospital. Now the pharmacy is just there in front of the hospital or by the side. So it's just there in case maybe in the hospital, the pharmacist that they have in the hospital does not have that drug. Like where I used to go that time, if you go, most times they will just prescribe the drugs for you. They'll tell you, oh, the clinic does not have this. We advise that you get it. Just go out across the road. You see the pharmacy, show them this prescription, they'll give you the drugs. So these are some of the things that we need to know. Okay, we've talked about the outpatient pharmacies located adjacent the hospital or serving the hospital. Okay, we also have the generic pharmacies too, that primarily dispense generic medications. Okay, now we'll get to medications. You see the generic ones, you see the chemical names for the medications, and so on as we progress. So pharmacies that primarily dispense generic medications, we have them that actually give names to these medications based on their chemical names. They actually put a name, a surface name on it. So when you get there, you see the surface name that is there, the ingredient that is actually active in the drug will be written there. And those are sensitive drugs, not just all drugs that come with their generic names. Very important. We are going to get to that shortly. Okay, I don't know.
Sorry, my skipped mail order pharmacy.
Yes, that's what I'm trying to do. I think something has blocked. Just give me a second. Let me see. There's something actually blocking my view from this side. Good. I think I'm there. Just give me a second. Sorry. Okay, good. Now, mail order pharmacies. What do we mean by mail order pharmacies? They are those pharmacies that actually specialize. That's their area of specialty. They specialize in dispensing medications for not just any kind of medication, but they dispense drugs and medications for specific diseases or for some conditions. Like we have antiretroviral drugs that are specifically for people that have AIDS, We have those that have maybe schizophrenia or Down syndrome. There are some drugs. So these mail order pharmacies are those pharmacies that dispense drugs that are very, very sensitive, that are specific for specific kind of diseases. So if you go to those kind of pharmacies, you don't get to see just any drug that you want. No, you don't get, you just go specifically for those special kinds of drugs that cure maybe one specific a serious disease or condition, just like the HIV or the rare disease. Schizophrenia, bipolar disorder, there are people that have drugs that are sensitive. It's not just common. And such drugs, you don't just walk into any pharmacy and expect to see the drugs. No, they are special drugs. And so they are kept specially in strategic pharmacies. So I think, I don't know. Can we move? Nena, can we move?
Yes, go ahead.
Okay.
Go ahead.
All right. Now we are looking at retail pharmacies. Okay, that's we already know. Pharmacies that are not located within a grocery store or small, like more or less you can call it maybe chemists or where you just have small places that are on their own. They're not located within maybe big supermarkets or grocery stores or within any other retail establishment. They're just there on their own. So those are retail pharmacies where you get to get maybe simple drugs. You just walk through, you want to buy this drug and you want to buy it just in a small setting. So those ones are the retail pharmacies. Then we have the pharmacies that are located within department stores, department store pharmacies. Pharmacies that are located within department stores, big stores where you have things too. You have big things that you are selling. And in these department stores, most times people come to the difference from the other one that we have seen earlier. People come to get medications, maybe in wholesale, they sell wholesale. So if you have a smaller, like a retail pharmacy, you come here to this type of pharmacies and get drugs in larger quantities, maybe wholesalers, you can call them that, you get it to use. So now we have government pharmacies too, where we have veteran affairs. Good. Now, veteran affairs, in the war, during the war, we have some pharmacies that take care of veterans. They take care of maybe soldiers that have served the U.S. Army for so many years, or they are elderly people, they have actually been agile all their life. So, they've passed through a lot of trauma, they've passed through a lot of things. So they are specialists, they are special medicines, they are special people that are pharmacists that are actually attached to taking care of them. We also have the military pharmacies too, that is located on military bases, serving the needs of military personnel and their families, like barracks. If you have been to the barracks, you see military pharmacies. They will just tell you, get there to get drugs. You are a soldier, you just have one issue or the other. They tell you, go get your drugs. You get to the military pharmacy and they take, even those that are not around, maybe they go for peacekeeping or they go to serve the government one place or the other. Their families are still taken care of from the pharmacy. If they have any challenge after did you seeing the doctors, everything they get to see, and they supply those drugs to them. That is, they ship in those drugs to them. They ensure they have drugs to take care of the families of these military personnel, or to take care of military personnel themselves that actually have this illness. So that is the military pharmacy for you. Okay, we also have other settings too, long-term care facility pharmacies. There are places that maybe in residential facilities or nursing homes. Sometimes maybe those of us that are actually into maybe caregiving or doing care work, you see that most of these facilities, maybe residential homes, maybe nursing homes where you have people stay there, or assisted living facilities or long-term care settings, we have pharmacies there. The pharmacy is just there to help take care of the patients that are within that particular area. And such pharmacies, one, drugs are normally cheaper there. Secondly, the government is always subsidizing the drugs, especially in UK and maybe others. They always subsidize the drugs because that setting is for vulnerable people, for people that are actually ill. So they take care of their expenses. Most of the drugs given there are either free or subsidized. Then we also have the pharmacies that deliver medications to patients in their homes. That's home healthcare agencies. There are also pharmacies. They move around, like you can see that van. They ship the drugs, they take in the drugs, and they deliver these medications to patients in their homes, especially patients that maybe have mobility issues and they are in their residential facility, their own homes, let me say so. So in order not to inconvenience them, this home health care, where they actually render the care to them, they move around with these drugs and ensure that the patients actually have their own drugs. Good. They also have, there are research institutions too, pharmacies that support research and development activities in the pharmaceutical setting. We have some research institutions. Now, what these research institutions do is that they carry out research, they begin to study the efficacy of drugs, they begin to see those drugs, mostly they are always working around the clock to ensure that the drugs that are no more potent is done away with, they do away with it, and the drugs that maybe the side effects are harmful or hazardous, they do away with it. So they keep carrying out research. Now, they call them pharmacies because they play a very vital role in coming together, forming the drugs, in putting the drugs together, and they play a very important role in the pharmaceutical industry as a whole. They keep carrying out research, moving with the times, moving with technology, stepping up drugs, doing away with the ones that are not good, bringing up the ones that are more potent, and so on and so forth. They are always working around the clock, carrying out research. So they are researcher institutions. Now, it is important that as a pharmacy technician, I said earlier, you understand the types of pharmacies. And you understanding this type of pharmacies can help you to make informed decisions about their career path. It's important because you may want to be a pharmacy technician that wants to work in, maybe you want to work in a big pharmacy. You even want to be a member or a part of the team that carry out research, maybe the research institution, or you want to work in hospital pharmacies. It's important or you want to have your own retail pharmacy. You want to have your own shop where you can just get your drugs wholesale and then you sell your drugs, a retail pharmacy, to people around, or you want to work in the community pharmacy. These are things that you need to know as a pharmacy technician so you can make your choice, and your choice will help you to make informed decisions as to your career path or how you may wish to continue or to move higher the ladder. So, okay, now I am feeling a bit, I don't know. I'm not happy that Pat is not communicating. I'm not happy because at the end of the day, it's just one person. We are actually supposed to be 3 in this particular training, or for this training. I don't know what's happening to Martha Ijoma. She was supposed to join us, but I don't know. She was finding it difficult to log in, but every other person has logged in. So guess it's her network. We would have been able to really rub minds and then talk. But nevertheless, I don't know if Pat can hear me. Pat, please, at any point you can hear me, kindly let me hear your voice, because I like to carry everybody along in a training. I wouldn't like to be talking to Madam Nena alone. That will not make me very happy at the end of the day. So now, pharmacy roles depends on the setting, like we already talked about, and your level of experience. Who is a pharmacist? In the course of us taking this training and on the group, we've had a lot of questions for those that have been on. Some people ask, okay, am I supposed to do this? Am I supposed to do that? Can I have my own pharmacy? Can I do this? Can I do that? Those were very good questions. So this would help us. Now, a pharmacist is a licensed professional. Is someone that has to pass through examinations, has to go through the university, perhaps graduate as a pharmacist, and is a licensed person that dispenses medication and then monitors the outcome and provides counseling. Totally. A pharmacist is responsible for ensuring effective use of medications and also counseling the patients. That's the duty of a pharmacy. We've talked about the pharmacy practice already, which incorporates some of these things that I'm talking about. That is a pharmacist. Should be able to dispense medications, know the formation of a particular medication, the formula, what are the constituents of a particular drug. A pharmacist should know. That's why most pharmacists, if you go to them, maybe you don't want to go the hospital route, you know us in Nigeria, you don't want to move the hospital route, and you don't want to move the hospital route. Then you walk to a pharmacy and you want to find out. Maybe pharmacy will ask, okay, what's the challenge? What are you facing? This, you explain everything. Sometimes you see them say, okay, I know the right drug just for you. I know what would help you. When you take this, to be like, they'll pick it and give you. Why? Because though they are not doctors, but they deal with drugs, they know the constituents of these drugs. They know what constitutes a particular medication. So because they know the factors, they know the potency of every drug, they can easily tell you, okay, this drug is this. But it's always advisable to get prescription from a medical doctor. But we have pharmacists that are very, very knowledgeable in drugs. They know exactly what to do. So that's why when you get to very big pharmacies, you even have doctors there. If you have some challenges and maybe you are confused as to what to buy and you don't want to follow the hospital trend, they'll ask you to consult the pharmacist, to see the pharmacist. Why? So that you can explain when you tell the pharmacist the things you are going through, how it is with you. It's very easy for the pharmacist to say, okay, this is what you're supposed to. Okay, because this is what you are supposed to get, and this is what you are not supposed to get. You know, very, very important. At the end of the day, you are not supposed to take these drugs because of this, or you are supposed to take this one because of this. These are things that are very, very important for us to know. So these are things that a pharmacist supposed to do. A pharmacist. Okay, what about a pharmacy technician? Because that one concerns us. Now, a pharmacy technician works under the supervision of a pharmacist. Let's understand that. It's just like a certified nursing assistant works under the supervision of a nurse, of a registered nurse. So a pharmacy technician works directly under a pharmacist. You report to the pharmacist, you do your own due diligence, you work within the scope of your duties, you can discuss with the patients, you find out whatever it is, but you always learn, you always end with the pharmacist actually giving the final say. So now you work directly with the pharmacist, you assist the pharmacist with dispensing the drugs, performing administrative tasks, maybe having the folders, maybe having the kit into the computer, the particular drugs, the follow-up of the patient. Maybe you have been administering drugs to the patient over this time. There has to be a record, there has to be a follow-up for continuity. There, so you do the administrative work, calling, maybe if the drugs are not available, okay, you call, reach out to them for the like mail order drugs. Those maybe you call them, okay, antiretroviral drugs are available, you need to come get yours, and all those administrative work, answering the phone, customer service. These things falls under your own job description, sorry. So it's very important for us to note. So practically, filling the prescriptions, maintaining inventory, you have to follow up. On no account should drugs be exhausted in the pharmacy. take note of inventory levels. Find out the drugs that are in high demand, that so many people need it. You know, many people have been buying these particular drugs. What do you do? That's why I tell people that there are things we need to know. If you have a faint knowledge of supply chain, you'll be able to know, you'll be able to at least to a large extent understand what I'm saying in this regard. Supply chain, because you would have to carry out inventory, find out, okay, so time in the year, we used to have shortages of these drugs because it's a rainy season and there's a lot of mosquito bites around in that community. So as such, the prices, the demand for malaria drugs is going to be high. So you keep inventory, you ensure that there's no shortage of drugs. Imagine a situation whereby a prescription is given to a patient and the patient comes to a pharmacy that he or she believes that I will get, is a big pharmacy, I will get the drugs I need, only to get there and it's not available. What do you think can happen? Remember, there's a very thin thin line between life and death. So it is important that at that split second where the person cannot get that care, the person cannot get that medication, things can go wrong. A lot of water can go under the bridge. So it is important that you keep inventory as a pharmacy technician. You find out the drugs that are in high demand. You ensure that there is no shortage of those drugs. You keep tabs with the pharmacies because, of course, the pharmacists will not be able to do this inventory I'm talking about. It's because they are there to do the major job. You have to keep inventory, relate with parents with a smile. With patients with a smile, like you can see that beautiful lady. So we also have the pharmacy aides too.
Hello, sorry.
Yes, please. Yeah.
Can you throw more light on this filing? Is it filling prescriptions or something? Let me understand the problem.
Okay, filling prescriptions. Okay, filling prescriptions simply means, for instance, someone walks into a pharmacy with a doctor's prescription. Doctor has prescribed 2 of paracetamol. So that's like you having a record of what you are actually dispensing or going to dispense to the patient. I don't know if you understand what I'm saying. For instance, yes, that's keeping a record of what you are going to do. Maybe you get into a shop now and you tell the person, you give the paper, this is my list, this is what I'm going to buy. The person has to, okay, you want paracetamol. Okay, let's see, do we have paracetamol? How many do we have in stock? Okay, paracetamol here. We want maybe ibuprofen. You check, do we have it in stock? That is filling in. You have to ensure that you fill the prescription. You give the necessary drugs that are on the doctor's prescription to the patient. That's actually the process of doing that. That's filling in. So performing administrative tasks too, very important that we do that. I've already explained that too. So pharmacy aides, there is another field too they call pharmacy aides. Is different from a pharmacy technician. And after the pharmacy is higher in the hierarchy. Now the pharmacy aides are the entry-level workers. Let's just say the people that they just assist. Their duty primarily is maybe to errands or just to do maybe the little jobs here and there. They assist, they work with the pharmacists and the pharmacy technicians. Very important. They typically work under the direct supervision of the pharmacist or the technician. And the kind of duty they do, they carry out those duties that do not require advanced training or certification. They don't even need, pharmacy aides don't need certifications. Like you are coming to take this pharmacy technician to actually have your certification at the end of the day. Pharmacy aides do not need any advanced training because the things they do are not technical. The duties they carry out are not crucial duties. They're just moving around like that. So maybe do this, get the papers, get the drug from the shelf, and so on and so forth. Those are just the things that they actually do. So pharmacy aides are different from pharmacy technicians. Please, let's take note of that. Okay, we also have other pharmacy staff. We have the interns too. you know, that maybe they have their degree, they gain practical knowledge working in a pharmacy. It's just something like we say, maybe internship, you know, where they have to go and get extra knowledge, hands-on, look at these things firsthand, how it is done, different from what they see, the theoretical aspect that they have been doing. Okay, so yeah, so they assist with various tasks, just as I said, like filling in the prescriptions, counseling the patients. They do a couple of those. Remember, there are people that have graduated, but they have to have the knowledge. They have to have the required knowledge, you know, to learn from it, from what they are actually what they were actually taught when they were in school. So now we also have the clerks too. We have the pharmacy clerks that just work in the front desk, you know, of the pharmacy. They process these prescriptions. They look for insurance information from customers. You know, this insurance information, there are some pharmacies that they're already on insurance, so you don't charge them. They already have an insurance bundle. So whenever they need drugs, they just approach that pharmacy. They have an agreement. They approach that pharmacy and they have a number. Their files are different, you know, and you just get to do that. Like I know when my father was still alive, we used to go whenever he's ill, because he was a military officer. So whenever he's ill, we get to military hospital, we get to the pharmacy department. We don't pay for drugs because once we go, he has a number. I think that's NHS or something. They have a number, and with that number, with that file, once we get there, the pharmacy, the clerk, you know, sometimes the pharmacy aides do that too. They help us sort the file. They'll say, okay, please, what's the number of the file? What's the color of the flag on the file? There's how they arrange the folders. So they just pick it up. And we know we are not paying for the drugs. I mean, they know we are not paying for it, but they have to document it because the military actually pays for it. So these are some of the things that the pharmacy clerk does. That's the insurance they are talking about. And then the payment too, how they go about filling in the receipts for the medical facility, I mean, for the military facility or the military to get the bill of how far or how much that person has actually exhausted. Okay. All right, so that's practically all about. They also stock shelves, like we talked about, from new drugs coming, they record inventory, they maintain the patient files and tidy up the pharmacy. These are what the clerks actually do. These duties are not for the pharmacy technician, but it's important we get to learn that and have an overview. So now, what is the duty? We've talked about that. Now, what is the duty of a certified pharmacy technician? Now, we have narrowed it to pharmacy technician. Now, what is the duty? A pharmacy technician actually does a lot of things. I'm not going to be reading from the slides, but you can look at the slides. Now, they do a lot of work. They are very, very important in the pharmaceutical setting. Medication, they help with the preparing medications. They prepare and dispense these medications as prescribed by the physician. Important. Now, for instance, a doctor prescribes a new medication for a patient with high blood pressure. Let's assume maybe there's a patient that has blood pressure, and the pharmacy technician retrieves the appropriate medication from the shelf, a new medication. So the technician goes to the shelf and looks for that medication and retrieves it from the shelf. Now, that's not all. The technician has to measures the correct dosage and labels the prescription before handing it over to the pharmacist for final verification. So you see, very important. Prescription filling, like we talked about, receiving and processing prescription, counting the medications, and labeling vials. What do we mean by vials? Vials, those containers you can see that drugs are put in. So you have to label them. They are called vials. You have to put the name, you have to put the dose, you have to put a lot of things so that when someone picks the container, the person can, at a first glance, see the necessary information as to how many was the dose, like who has the drugs and all that, and how many times will the person actually, the quantity and the time. So those containers, like you can see there, we fed them, we call them vials. So those are some of the things that the pharmacy technician does: medication, filling in the prescription, inventory management, like we talked about, maintaining stock levels, ensuring that the drugs are there when it's getting out, when it's reducing. It is the duty of a pharmacy technician to alert, to tell the pharmacist that, oh, these drugs, we usually need it, tomorrow we need this quantity, and right now it's remaining 1 or 2. Let's act fast. Let's get the drugs, or order for the drugs to be sent. Patients counseling too. We assist the patients with understanding their medications. We already talked about that, the side effects. Now, you answer phone calls too. Yes, the clerks do that, but sometimes there are some pharmacies that don't have too many, maybe 1 or 2 clerks. They don't have enough. So you intermittently can answer phone calls. You can schedule appointments for patients to come over to see the pharmacist. You can also help process insurance claims, like we talked about earlier. So these are things that the pharmacy technician does. Assisting the customers with their prescriptions, managing inventory, preparing customized medications for patients when they are commercially available options are unsuitable. So if the options there are unsuitable, it is still the duty of the pharmacy technician to work pari passu, work hand in hand with the pharmacist to ensure that every patient actually has the right medication at the right dose and administered properly. This is very important. We cannot overemphasize that particular fact. So that being said, we still have to move when it's exactly, I don't know, when do you think we should have break? Normally we're supposed to go for break by 6:30, but we still have a lot to do. So I don't know, since we are few, I'd like to hear your opinion. Madam Pat, still no volume from her end. Madam Pat, okay. Madam Nenna, what do you think concerning the break? Because we don't take 3 hours training without having a break. Would you like us to continue, or we take a break for just 10 minutes and we are back? Because 8 o'clock, we are out of here. I don't intend to keep us more than.
We can continue if you are willing. I don't have a problem.
Okay, because I need to find out. Madam Pat, I haven't heard anything from her, so.
Maybe network is disturbing.
But she was actually here. She was really, really supportive. She was like, oh, let's wait for others. Let's wait. I was thinking she'll even be bored.
Yeah.
I'm surprised now I can't hear her. Maybe it's network.
Yeah.
All right. So ethics and professionalism in every profession, in every standard profession, there are ethics. And for the pharmacy, in the pharmacy practice, there are ethics. It guides your behavior. How do you behave? This is very important. How do you behave in a pharmaceutical, in your profession as a pharmacist? This is important for us to understand. So that's what we are going to be looking at this particular moment. Ethics and professionalism of a pharmacy technician, or ethics and professionalism in the pharmaceutical practice. That's what we are going to be looking at. Now, there are many things, principles that we need to note in this particular field. Patients' welfare should be paramount in our minds. Like I said, I know that I cannot overemphasize the importance for us to be careful, the importance for us to really know how to discuss with our patients, for us to be very, very careful in what we do, in the aspect of dispensing drugs, in the aspect of relating with our patients is very important, because human life, I still hammer on it. Any little mistake, we cannot. In this profession, you cannot afford to gamble with human life, because any little mistake you do can cost a person's life. So, hence, patient's welfare, your paramount priority, or your paramount, what should be paramount in your mind as a pharmacy technician is the well-being of any patient that you come across in the course of carrying out your duty. So you place the patient's well-being above any other thing. Competence, a level of competence in the field. You must be competent in what you're actually doing. You have to have the right knowledge. You need to know what to do at any given time. Honesty and integrity. Remember, they need to trust you. Remember that you have to connect with these patients. Remember that they have to know that you have their interests at heart. They have to know that you are trustworthy. They have to see you as an authority, knowing that, yes, if I see Madam Nena, let me just get to Madam Nena's chemist pharmacy. When I get there, I'll tell her what is wrong with me. I know, I trust that she'll give me good advice. She'll tell me exactly. So that is based on integrity. That is based on being honesty. Then confidentiality too is very important. Like we said, that is one of something that we should not lose guard of. Privacy of the patient and confidentiality. I said it earlier that we should not divulge any information concerning any patient to a third party except for legal reasons, or maybe for the sake of or in line with helping that patient. And it must be between the healthcare team or maybe the legal aspect if the need arises or something happens and legally they need this information from you. Now, you will have to adhere to professional standards and do not avoid any behavior that would harm your profession. We know behaviors that harm our professions, not knowing what we are doing. For instance, like in the nursing sector, we get to hear a lot of things, the way some nurses, behave. And the health world or the health setting has I've seen so many things. We've seen patients treated anyhow. We've seen lackadaisical attitude in the aspect of the patients. I beg your pardon, in the aspects of the nurses, of the healthcare practitioners. They don't take their job seriously because you see, due to negligence, due to misbehavior, something can happen to a person. A person can either lose a pregnancy or lose his or her life, or, compound the illness and make it severe because of just a singular act of someone that is not professional, that is not adhering to professional standards. So these are some of the things we should take note of. Okay, privacy, confidentiality, failure, invasion of privacy. These are some of the things that we already talked about. So now, pharmacy professionals have an obligation, a legal obligation to protect patient privacy and confidentiality. That one, I cannot even, in anything that you have to do with the legal field, though, whether you are a nurse, whether you are a doctor, whether you are a health worker, whether you are a pharmacist, in any of the role that you play in the health field, we cannot overemphasize, we cannot overstress patient privacy and confidentiality. It is very important. Secure handling of patients' data. Keep it safe. Keep it safe. There's no story of saying that maybe something happened and as such you couldn't do what you were supposed to do. No. Something happened and you kept maybe files carelessly. Maybe it was a doctored or something happened to it. You have to keep it safe. You have to make sure that unauthorized persons don't have access to certain information of your patients or get to certain files. People that don't have the authority, they are not authorized to access certain files. You keep them safe. Communication with patients. Obtain patients' consent before you share their information with anybody. That's the bottom line. Be it the health setting or whenever you need to share their information with anybody, be careful. Ensure that you seek their consent first. Let them give you the go-ahead to do so before you do it. So that you don't find... At this point, we want to talk about how to prevent medication errors.
Sorry, ma, the other side, I don't think you're done with me. Except I'm not...
This one, communicating with patients, which one?
Just HPAA compliance.
Okay, HIPAA. Okay. HIPAA compliance. Okay, HIPAA is an association that is a very strong association that deals with compatibility, accountability of health insurance, anything that has got to do with patients, their insurance, the legal aspect of it. They are into that. That's what they do. They govern, their laws protect patients' health information. So if you divulge a patient's information, you will have issues with HIPAA, Health Insurance Portability and Accountability Act. It is an act, like I said, that governs, that protects patients, that protects their information, that protects what you as a medical person or a pharmacist or a pharmacy technician can do and cannot do with a patient. That is the act. It's very big, it's voluminous. Every pharmacist has it because it's a legal form of you looking at the pros and the cons of the things you can do with the patient, of the extent you can go and the extent you cannot go. It's a very big document. So that is HIPAA. That's the full meaning of HIPAA, Health Insurance Portability and Accountability Act, HIPAA. So
Okay.
I think, can we go
Yeah.
ahead?
Mm.
All right. Thank you. So now, how to prevent medication? Okay, quickly, let's just visualize a scenario. I think we are mothers, so some of us can understand when we talk about cakes. We talk about making cakes, or we talk about cookies. Now, take for example, just look at maybe a town or a city where there is one particular beloved local bakery. There's a bakery that you love to buy delicious pastries from. Maybe you like to get your pastries there. But one day, the baker accidentally mixed up the sugar and salt. We are getting at something. Now, accidentally, the beloved pastries you used to love to purchase from that particular beloved bakery that you love so much, the baker, maybe Mr. John or Mr. Paul, let's just give him Mr. Paul, now accidentally mixes up sugar and salt while preparing a batch of famous cookies that you always purchase, that you love. What do you think the results would be? Now, the result will be a batch of cookies that will taste horrible because of the mixture. And several customers, maybe after mixing it like that, people now purchase these cookies, and it made several customers feel ill after indulging in it, after taking it. This incident that I've just told you now maybe quickly spreads through the community, leading to a loss of trust and customers. Before you know, people say, at that bakery, no, don't go to Mr. Paul's bakery. The other time he accidentally mixed salt and sugar together. You understand? So people now began to wonder, what else might be wrong in this perfect bakery? You see, people now begin to begin to think of so many other things. This one that they just mix this and we are having this terrible taste. Who knows what else would happen? So just like this scenario, I just want to give you that illustration so that you relate it to what we are doing. Just like Mr. Thompson's, Mr. Paul's mishap, medication errors can have serious consequences. This particular module, this very particular point is very important for us to get. It can create a lot of serious consequences for patients. So when pharmacy technicians overlook safety protocols or make simple mistakes, like I told you earlier, the effects can be far-reaching, causing harm to patients, killing trust. Just as I said, that the community will begin to run away from that bakery. They will not, because the trust has already been hampered, because they will be thinking of what other things, what more can they expect? What more negative things can they expect to come from that bakery? That's just the same thing. So it can cause harm and make people to lose trust in healthcare providers, which will lead to serious repercussions. Very important. Is the fact that we have to be very careful when we deal with medications. We must take steps to prevent errors and ensure that the safe handling and administration of medications, that we do that. Very important. How do you handle, how do you administer? These are important. This is not only about you giving the right dose, but how do you actually administer these medications? How do you actually store them? There are those ones that are to be kept in room temperature. There are those ones that you should keep in the fridge. You should maintain the coldness. It should be in a cold state. All these things are very, very important. Storage of medicines, very important for pharmacy technicians. Now, these are some of the things you can do. Follow proper procedure. That is one. There are already established procedures for handling drugs, for dispensing them, and administering this medication. So do not all follow the right procedures. Check these prescriptions before giving, review them to ensure accuracy, because as a pharmacy technician, you would finish doing the drugs, you hand over put together the drugs, label it, do all the things you know how to do best, but at the end, you still have to present pharmacist. I say you work directly under the pharmacist. You cannot just on your own dispense the drugs and say, okay, this is your prescription, you fill the prescription, then you hand over to the patient. No. Why? Because you are not a pharmacist. If anything goes wrong, the pharmacist firsthand will be held responsible. So because you know your duties, because you know your limits, when you do these things, you double check to ensure accuracy. Then you show to the pharmacist, let the pharmacist confirm that it is in order before the patient is actually administered this medication or given the medication. Very important. Implement strategies to prevent common medication errors. Very important, such as maybe drugs that look alike. Drugs. Very important. You have to know brand names, like we are going to see generic names, so that you don't confuse drugs. That's you don't carry one and add to another. Very, very wrong to do that. Okay. All right. Just give me a sec. Let me drink water because I'm a bit thirsty, so we can continue.
Okay, ma'am. Okay, ma'am.
All right, please, just a sec. Technician, as a pharmacist, you need to keep yourself hydrated because dehydration kills very fast. So, medication errors. We talked about look-alike drugs. Sometimes you get packets of drugs that look like. You get vials, mistake, it can cost a person's life. No gambling is involved when we are dealing with health or human life. Report medication errors to appropriate authorities and take steps to prevent similar errors. Now, I want to give you an illustration. A pharmacy, I think 2 years ago, if I'm not mistaken, to get drugs. And I didn't meet the pharmacist. I met the pharmacy technician. I met the people and the clerks, just those. So I wanted to buy a particular drug. Thank you. I wanted to buy a particular drug, even another container. I was given another one. Did I know, as at that time, I wasn't into health like I did so many years, it's not 2 years. I think that was my very first experience is so many years ago. Then I hadn't entered. So then I was just a layman, like I would say. So I just went, I gave the prescription. The pharmacist was not around, but the technician was around. She picked the drug, she interchanged the drug and gave me another. They used to have a similar container, but not the same. Not but similar. But because a hospital, it happens. Even you get to hear of a whole lot in the health system. I tell you, a whole lot anomalies is happening. Some situations, a doctor carries out surgery and forgets gloves inside the patient or forgets this. You see a nurse with their attitude, some nurses, not all. You see some patients have lost their life. So it's even in the pharmacy, this, and they mistakenly gave the other one, and knowing that they don't do their job, they are not professional about what they do, so they just give the drugs for the giving of it, and they are not even interested how you take the drug. Oh, you want a paracetamol, for instance. Okay, they just give you, how many do you want? They are not even interested, they just give it to you. So it's important that let's not expecting knowledge is expensive. I tell them to try paying for ignorance and see what you can see. So it is important that we get the right knowledge. If we really, really want to be professionals in our field, we really, really want to be maybe pharmacy technicians and play our own parts in this healthcare system, support this area. So when she gave me that drugs, I went home. So when I went home, I showed it to my father. Thank God my father had a little knowledge of medicine. So even though he was in the military, he had a knowledge of medicine. So he now looked at it. He said, which drug is this? I can't even remember the drug because it's so many years ago. I was still, I think, if not in secondary school that time, it's far, far. So I can't remember the exact drugs, the container for me. And look at it. He said, put it on his, that smelt it and said, no, this is not how this syrup used to smell. No. There's something wrong. So he looked at the name and he looked at the expiration date. He looked at the name. He looked at some vital information. And when he saw it, there was problem. When my father was in the military, like I said, of blessed memory, he's late now, was in the military. I cannot tell you what happened. We got back to the pharmacy and then we tried to see how to sort that out. But the girl was like, oh, please, they'll send her away. You know, all these people that she was afraid that when the pharmacist eventually gets wind of it, that it will cost her her job. She will be asked she'll be sent away and all that. So she was looking at it from that angle. But we were looking at the angle of ensuring that it is reported to the pharmacy by pharmacists. So that action can be taken, not to let her, so that it will not repeat again, so that it will not happen again. But she was looking at it in the aspect of losing her job, which I understand, but we're looking at the total benefits of everyone, because so that it doesn't repeat again. So, and steps are taken to prevent such happening again. So we should be very, very careful when we do these things. We should be very careful, so that we don't have these errors happening again or happening all the time. It can be very, very devastating. So also pharmacy professionals are also expected to behave in a professional manner at all times. Already respectful behavior, treats the patients with respect, regardless of what the illness is. Or even those that have HIV, those that have AIDS, we have the stigmatization thing. Do not say, child, I cannot. How can I go and give those So that person has HIV, Jesus. And we do all those things. No, because we should treat them with respect, regardless of, we should first of all look at them as a human being before the illness. So every human being needs to be treated with respect. So if you see from that angle, no matter what is the illness that brought the person with the prescription, no matter what the prescription is, we shouldn't look down on them. We should show respectful behavior, avoid conflict of interest too, disclosing any potential conflict of interest, and avoid situations that could compromise their professional judgment. Yes, sometimes you get situations whereby you may wish to maybe compromise your professional judgment, maybe because this person is your maybe family member, or somebody you know, or somebody that knows somebody that you know. No, regardless of it, at all times, remember honesty, truthfulness, say it just the way it is, do it the proper way that it should be done. Participate in continuing education activities too, very important. Stay up to date. Do not be analog oriented. Let's move. Let's digitalize this particular practice. Let's begin to move with the times and begin to keep ourselves updated with the current trends in medicine, telepathy, and other new trends in medicine that is actually coming out. We should have trainings. We should take, we should create, we should keep upgrading ourselves so that we would move with the times. Very important. Again, we should comply with all relevant laws. I had already said that. Laws, this regulated, like I said, is filled with so many laws. So it is important that we try to, as much as possible, laws with what we the laws that are on ground. Now, we should also not work alone. We should not be taking unilateral decisions. We should not stand alone. As a pharmacy technician, you are a very important member of a healthcare team. I want you to understand that. So there has to be collaboration. You have to work with the pharmacist. You have to work with members of the health team, because you would help to synergize, to take care of, to give a holistic care plan for the patient, create a safe environment for the patient. And when you work together, it will be easier to tailor a particular medication or tailor a particular care towards a person, to be patient-centered, on the person, depending on what the person's illness is. So it's very important. Collaboration, teamwork is more than important for everyone that is involved in this. Don't work alone. Work with other people. Work with other people. This is very important. Okay. All right. Now, I want to give you a little scenario. I pray the time will take us because our time is moving. We already not wasted per se. We already waited for 30 minutes. So I don't know, would have to take a little bit, maybe just 10 minutes after it. And then I don't intend to keep anyone or you, Madam Nena or Madam Pat, more than the time. So it is important. Now, I want to give you maybe a brief, I want to tell you what a pharmacy technician can do. Now, sometimes you can notice a particular prescription that doesn't go down well. That doesn't go down well, you know. Let me give you an instance, maybe for someone, just a make-believe name, maybe Emily, let's use maybe Emily at a pharmacy, preparing for the busy day. The phone rings constantly and the prescription counter is lined with patients. Now, among those patients is one particular man who had come to pick his regular medications as usual. He's here to pick his normal medications, his regular medications. But Emily now observed that he had a new medication altogether, that his prescription was reading a new medication different from what he normally used to take, you know. And when she looked into it, she saw that it was a blood thinner that could interact with other medications. It could thin the blood. It thins the blood, the medication he was given on his prescription. So remembering her training and the importance of checking for drug interactions, looking at how drugs can, she immediately decided to double check. After checking the drug, she noticed that the man from his regimen, from his care plan or his folder, she observed that he was already taking an over-the-counter pain relief that could increase the risk of bleeding when combined with a new blood thinner. Immediately, she consulted a pharmacist. That's why I say that you have a role to play. Immediately, because she saw it firsthand before the pharmacist, she consulted the pharmacist, you understand, and explained the situation. Together, they both reviewed the patient profile and they confirmed the potential risk of that patient taking that drug that is a blood thinner that thins the blood. Understand? So she called the office and explained everything. So the doctor that actually prescribed that drug appreciated the call and confirmed that he wanted to adjust the pain relief dosage instead of stopping it entirely. That's what he wanted to do, adjusting it and also giving him that blood thinner so that it will give him a leverage for him to be able to sleep. You understand? Because he had sleeping issues, insomnia, he had that. So, but having listened to them, he took time, Emily now took time to explain how he should take the medication and explain to the patient why he needs to take it properly and what would happen when he takes the medication. So you see that as a pharmacy technician, you have a lot of things. You have a big role to play. Partnership, communication with the doctor, with the nurse, anything that is out of the ordinary, report immediately to the pharmacist so that action can be taken. All right, communication is very important. Communication, effective communication, and honest communication among the providers. Work together as a team. Listen actively to the needs of the patient when they come to you. Do not transfer aggression. If anything happened, do not transfer aggression in the line of your work. They are the reason you are there, so you should pay attention to them. Listen actively. Listen to understand. Don't just listen to hear. Listen to understand what their challenges are, what they actually want. Respectfully communicate with the team members and avoid any disrespectful or negative behavior. Okay. Now, working with other healthcare team members, like the physicians, the nurses, the therapists, the doctors, you know, implement comprehensive care for the patients. It is important. We cannot overemphasize this. Now, it is also important for you to recognize and understand the responsibilities of other healthcare providers and work together to leverage their expertise. Work together with them because they have expert knowledge in different areas. So leverage on their expertise. You know, you're a pharmacy technician, you can learn from them. And also, experience is the best teacher. It comes, you get to some pharmacies that you even see pharmacy technicians, they even know how to prescribe drugs, not prescribe, but dispense drugs, and even tell you the consequence of drugs more than the pharmacists themselves. Why? Because of experience. They have garnered a knowledge to be able to go about it. They have learned over the years, they have leveraged on the knowledge of other healthcare practitioners in that field, and they are getting better. Share relevant information with other members of the team, necessary information that will help to provide care for the patients or for patients. This is important. Okay, so let us see what we can do at this point. All right. Okay, so patient-centered care. What is this A to Z of patient-centered care? You addressing the patient's concerns, involve the patient, focus on the patient. Like you can see that diagram there. You can see the doctor, you can see the insurer, you can see the nurse, you can see the surgeon, everybody. You see the different arrows, everybody in their own ways and in their own corners, within their level of expertise, in their job, within their job prescription description. Sorry, I keep interchanging prescription because I'm talking of drugs. So everybody is working towards the patient in the center. So the the patient is it's in the central position. So every other person is geared, everything they do, just as the arrow points to the patient, is geared towards patient's care, is geared towards giving the patients extra care, giving the patients all the necessary care that the patients needs. So it's important that we learn how to address patients' concerns, we involve the patient, we focus on them, we work with the other members of the team. Good. As we can see there from the diagram, it's self-explanatory. Everything is about the patient. Okay, let's see what we have. The role of the technician. Providing medication information. That's one thing. Include proper usage, side effects, and potential interactions. Good. Like I said before, not just seeing drugs, you have to know what the drugs are meant for. You have to know the side effects. You have to be able to communicate. What is the therapy management? How do you manage? How is the person going to manage taking these drugs? How are you going to manage the patient taking these drugs? Assisting. Your duty is also to assist the pharmacists as you work with the pharmacists directly and other providers to manage the medication regimens. Like we said, keep tabs on how they take the medication, how far the person is going. Very important. Ensure medication safety, prevent medication errors. We've talked about that. Collaborate with other teams. We've also talked about that to ensure that the patient has the best possible care available. So that is that. So we are going to see how best we can just go through this module. At least let's get module 1 and 2. Since tomorrow is going to be in the morning, would have more time. Today we took 30 minutes behind schedule. So God willing, I want to see how we can wrap it up before we continue. Up until now, we cannot hear Madam Pats. Madam Nenna, can you hear me? Are we together? Do you have any question or anything to ask? Should I go ahead?
Yeah, go ahead. Go ahead. I'm flowing.
Okay. So please, if you have any question, do not feel deterred because you are the only one on the platform.
It's well.
Because some people will say, "Oh, I'm the only one. It's me that will lift myself. It's me that keeps. It's me that carries." Please don't feel that. Don't worry. No knowledge is wasted. And I'm looking forward to you owning a very big pharmacy soon. You remember. Very big pharmacy.
Amen.
Yes.
Amen.
All right. So let's look at introduction to pharmacology. Now, this one is drugs. Introduction to Pharmacology. Now, this is the main. We are moving into it. We are going to be having some scientific terminologies. So let's try to remember some of the things we learned in science as we go. So what is pharmacology? What is pharmacology? What is pharmacology? Now, let's see. The A to Z of pharmacology is simply the study of drugs. That is pharmacology. The study of drugs. How do we come about these drugs? What does the drug, or what do these drugs do in the human body? How do they act in the human body? That is pharmacology. How this drug works in the body. It looks at how drugs affect our health, how they can help us. You know, drugs there are drugs that can help us and also harm us. So most of the drugs we take with the doctors prescribe is always on a balance. What do I mean by a balance? If they see that the side effects of the drugs is less than the advantages you get from that drug, or from that drug, or from those drugs, it gives them a leverage to give you the drugs. So how do they know these things? Is the knowledge of pharmacology, is the study of the constituents of these drugs, of what did these drugs actually do, what do they work against, when someone swallows it, how does it function in the body, what does it do? Because you find out that maybe someone is having headache, for instance, you give the person paracetamol, and the person takes paracetamol. And before you know, the person is like, oh, I'm okay now, the headache has subsided. So that is pharmacology. You study these drugs and how did that paracetamol actually work in the person's body? What did it do to ensure that the person I saw that just had headache now is not having headache again? That is just it. The reason I said I was going to break it down is to ask if anyone had a science knowledge. Is the way I'm going to take this from here is going to be down to that's self-explanatory. I'm going to bring it right down so that you would understand. So that is what pharmacology talks about. Having a foundational knowledge of pharmacology is important to ensure that you give safe and effective medication to your patients. That is why this particular topic is important. Okay. Now, it is a branch of medicine. People go into study pharmacology. That is what they really do. They strictly do. So that one, they would dissect pharmacology, the A to the Z of it. You understand? They are pharmacologists, people that is their profession. So in a nutshell, we are going to be looking at what this pharmacology is and what it entails. Now, when we talk about pharmacology, there are two major things we should look at. That is pharmacokinetics. That's one, and pharmacodynamics. There are two different things. Now, what is pharmacokinetics? That's one. Kinetics talks about how the body processes the drugs. That is just it. It talks about how the body handles a drug. How does it absorb it? Like I talked about paracetamol. How does it absorb? How does the body absorb that paracetamol that I just took? That is what I'm trying to say. Now, how does it distribute it? So which parts of the body does that paracetamol actually get to? And then, how does it come out? How do I excrete it? How do I excrete fragments of those paracetamol? Or what does my excreta look like after I have taken paracetamol? Does it have some byproduct of the paracetamol or it does not? Everything put together holistically is what we look at under pharmacokinetics. And then, okay, so that's pharmacokinetics. Now, for instance, when you take a pill, your body breaks it down. When you take a particular medicine, your body breaks it down and sends it into your bloodstream. It sends it. When you take any medicine, your body automatically uses the devices to break that particular medicine down, and it enters your bloodstream. It enters your blood. So that is how it is distributed in your body. That's how your body absorbs it. Then pharmacodynamics focuses on how the drug affects your body. For instance, how a drug lowers blood pressure. Like those that have high blood pressure, they'll be given BP drugs to say, okay, take. Now, pharmacodynamics talks about what that drug has done. It has lowered blood pressure. That is the dynamics. But the kinetics talks about how that blood pressure medicine is actually absorbed by the body, how it enters the blood, and then you excrete it out. So you see, there are two different things. As we progress, you would understand. I just try to break it to the barest minimum. I don't know if before we delve into the deeper aspects, Madam Nena, please, is that clear? Do you
Yeah,
understand?
somehow, let's move ahead.
Okay, somehow.
Somehow.
Okay. Okay, let's get back to it. This is what I mean. Let's get back, because me, I want you to understand. I said you have a big pharmacy, so it's important you understand. So,
Yes.
pharmacokinetics, that's kinetics. What does it talk about? It talks about how the body handles a drug. It talks about the handling mechanism of a drug. How does the body handle the drug? That's one thing. How it handles the drug. When you take it, it moves to here or it moves to there. What does it do? Processes in the body? That's the kinetics.
The processes, okay.
Yeah, that's the kinetics aspect of it. But the dynamics, pharmacodynamics aspect of it talks about, it focuses on how the drug affects the body. That's the therapeutic
what it does on the body.
Yes, what it does. It's just like that. When you take the BP blood pressure medicine, it goes, maybe works on your neurons, reduces the blood pressure. So working on your neurons, moving left, right, and center, that is the kinetics. That's the that's the movement. That's what it does. But the dynamics is the fact that because of all those kinetics, those working together, touching those places, and doing all those things, it has finally brought down your blood pressure. That is the pressure. You understand?
Okay.
So that's the difference between the two. So now, importance of pharmacology for technicians. You have to understand medication actions. That is why we are going into this. Recognize the side effects of it, of each drug, of drugs. Recognize the side effects, what it does. Practically. Detect drug interactions. Because when you look at, like, those that study pharmacology in detail, for us on this platform, for this pharmacy technician course, we cannot extensively dissect each drug or the mechanisms of different drugs, like expand them. No, because it's for a higher, when we get to maybe become pharmacists, the higher levels, that is where you delve into it properly. And the beautiful thing of it is, if you even major in a particular field, like you're a pharmacologist, then you will know how to break down these things. But for pharmacy technician, we cannot delve deeply into, because you are not actually the frontliner in the preparation of these drugs. But it's important to have the knowledge. Now, you also provide counseling. So it's important that you offer accurate and informative counseling to your patient. That's why, at least to an extent, you have to know that's on the surface, what a particular drug does, or what is the value of the importance of the drug when someone takes it, or what is the reaction, what is the kinetic aspect of it, and the dynamic aspect of it. Is very important for us to understand, even though we don't delve intensively into it. Okay, so let's look at the kinetics now. It refers to how the body processes drugs, like I already talked about. And the body processes these drugs in two ways. Processes in four ways, in different ways, in four good ways. The body processes these drugs. Now, we have the absorption stage. Now, how it absorbs this drug. After absorbing the drug, distributes it. Absorption also talks about the method. Is it intravenous drug? Is it a swallowed, an oral drug? The swallowed one is oral. Is it anal drug? Like we have the anal ones that they will say, okay, inserts into your body. We have drugs in different methods that drugs can be administered, different routes. So the kinetics talks about the absorption, talks about the distribution, it talks about the metabolism and the excretion, how it moves. Understanding these processes is important. Now let's look at the processes one after the other. Like you can see this diagram. The movement of this drug from the absorption stage into circulation, when it is absorbed in the body, begins to move. it is circulated, sorry, in the body. It gets to the distribution stage. When it is circulated in the body, it is now distributed to various tissues that actually need to be need the how do I put it, that needs that particular drug, needs the efficacy or of that particular medication. So it's distributed to the various tissues in the body. Now, metabolism, how it is broken down. The drug is now broken down, and then maybe this one goes to the kidney, this one goes to the liver. Of course, we know kidneys and livers, there's no drug you take. That's why they tell you that when you take too much of antibiotics, it affects the liver, and you wonder why. Because there are some body parts, there are some parts of the body that are prone, that are very effective when it comes to drugs. So if you take any drug that has harmful effects, you hear it, you feel it in those parts of the body, the long-term effect of you taking those drugs will affect those particular organs of the body because of how very, very delicate and crucial they are, and because of what they actually do. So even eliminating excreta in urine or feces. So it's a whole round thing from number 1 to number 2 to metabolism to excretion, how it comes out. So that is the kinetics aspect of it, the movement. Okay, equally, this is still a rundown of the other page, which is talking about how it is, but this is more explanatory. Where you have the drugs enter the bloodstream, absorption, it gets into the body, it moves through the bloodstream, either injection, either topical, or oral injection, however it's taken. Oh, let me drink some water. Just give me 2 minutes, Nena, please. Please give me 2 minutes.
It's okay, ma. It's okay, ma. You can take.
Okay. You can equally just take 2 minutes yourself while I just stretch. Thank you.
Okay, okay.
All right. Okay. Are we together? And then are you back?
I'm here. I'm here.
Hmm.
I'm here, ma.
You not even stretch your leg. Yeah.
Well,
All right. It will soon be done. Don't worry. Thank you for your support and your patience. You are going to really be a very useful you will thrive, rather, let me say you will thrive in this line of business, this healthcare field.
amen. Amen.
You would. Be candid. You already have the features. Patience is one of them.
One of them.
Yeah, let's look at what we're saying. We're talking about absorption, oral, injection, topical. Now, topical medications are medications that are applied on the skin, on the body, to a particular place or in the body. Topical. So we have different ways that people can take medication. You can see we have medication application on the skin, the injection, the oral. So distribution, the movement of the drug from the
Sorry, ma'am.
bloodstream to the
Sorry.
organ.
What's this
Yes, please.
ADME? Okay,
Pardon?
this is the absorption. Okay, sorry.
Yes,
The
Hello?
ADME, yes.
Hello? Hello?
Yes, please, Madam Pat.
I've
Madam
been
Pat.
listening to you all this while, but you are not hearing me. I've been responding. You are not hearing
Wow.
me.
Jesus.
Wow.
Don't say it again, oh, Madam Pat.
I've only
Let
I was just jotting and listening to you.
Wow, wow, wow. Thank you. I was like, Madam Pat that opened this training with us, she was even patiently waiting for others. She told me, let's wait for the others. What's happening? I was sad, but I'm happy now, at least. I'm happy to hear that.
Welcome, Madam
To
Pat.
hear that.
Thank you, Madam Nena.
Yeah,
Thank you.
It's nice to have you. Thank God, because I was like, oh, Nena was already feeling, oh, I'm the only one. Am I the only one that wants to be? So I'm happy. All right. Okay, so we're talking about you asked ADME. So ADME is what you've answered the question yourself. That's we use that acronym to actually have an overview of how the pharmacokinetics works. The absorption, distribution, metabolism, excretion. Yes,
and
so it's just an acronym, ADME, the acronym.
yes.
Okay, so the metabolism is like you can see there, the body chemically alters a drug. Now, when it is being broken down, maybe because of the chemical constituents of our body, so many things happen in our body. You know, sometimes you take a drug and because of the way your body is, you know, this drug is actually broken down with all the processes coming into play, broken down into smaller inactive metabolites. That's little inactive I don't know how to explain. Yes, I wanted to ask Madam Pat. Madam Pat, since you say you can hear us, I asked Nena and I was about asking you, I wanted to ask, do you have any do you have a pharmaceutical background? Do you have a pharmacy or a chemist, or are you in the health field?
If you look at my profile picture, I thought you would have seen a little snap there. But
Okay.
I work in the pharmaceutical firm.
Oh, no wonder. I didn't actually see the profile picture anyway. Like maybe I saw, but I didn't really. Okay. So that's fine. I just needed to know. I always like to know the background of people that take training so that we'll know how we can do it. If we take it down or when I say something, I know they will understand. All right. So excretion 2, like we talked about, removal of the drug from the body through the kidney, through the liver, through the lungs, all those parts. That's why, like I said, this part they call kidney in the body. It receives a whole lot of things, you know. So that's why we get to hear of kidney diseases and so on and so forth, often being so rampant. So it depends also on the things that we take into our body. So this ADME primarily in the kinetics aspect of it talks about what you have seen: distribution, metabolism, excretion, and so on and so forth. Okay, our time is moving very fast. God help us. Okay, so in terms of the absorption, now, there are different routes of administration of drugs, like we talked about before. You know, we have the oral, the one you swallow, you take it through the mouth. We have the injectables, we have the topical, like I talked about, the skin. You know,
Yes.
So depend on how a drug is administered. It can go a long way in affecting the speed of the efficacy of that drug. For instance, I know when I was growing up, I used to be so scared of taking drugs, taking tablets like that, just with water. I'm one person that even up until now, it's not very easy for me to. I always quarrel with my husband in that regard, because there is no time, despite the knowledge I have, despite the height I've attained. He would tell me, you only know how to teach it, but you don't know how to do it. He would tell me that. And once I hear him say that, I know that he's referring to the fact that I'm not taking drugs.
Yes.
So when I grew up, I used to swallow. Before I take any tablet, I will have to tell my mother either I'll take it inside fufu or I'll take it inside a bowl of gari. that I want to swallow. It must be inside something that I can put the tablet inside and cover, that I will not even taste it. So then, as I was growing up, my mother would be telling me, when you put, she used to say that, you tell me, when you put a tablet inside fufu or gari, it's not going to digest fast. It's not going to digest fast. So if now you are telling me you are having severe headache, and then no, you are having this, and I said, okay, let me give you paracetamol. You want to put it inside, that it will take time. If the headache should just subside in 2 minutes, no, that is going to take like 50 minutes or 1 hour before, because of the fufu itself will do its work before the Panadol and paracetamol will now start to. So now as I grew up, and I now understood in a way what she said. So why am I saying this? The way you take a drug, even if it's oral, the way you take a drug matters. And it goes a long way in the absorption speed. We are told that when you take an intravenous injection, you take an injection through the veins, it gets faster. Why? Because it's straight into your blood. I mean, there's no, it's just like a tar road. There's nothing that will obstruct it. So it's advised that if it's something that is an emergency or something that they just need it to, work, to act fast immediately, it is preferable for you to take an injection intravenous than taking in box, So this is part of what I am saying. The route of administration goes a long way. Tablets, capsules, or solution influence how the drug is absorbed. Now, we also have the physiological factors too. The age, the weight, and gastrointestinal conditions can affect drug absorption. There are other things that could affect it. Depend on, 1, the illness a person has. 2, age. Age can also affect the way the rate of absorption. That's the kinetics. Now we are still talking of the kinetics. We're talking about the ADME. Now we are still breaking it down. So the weight, the gastrointestinal conditions can affect drug absorption. The intestine, the condition of your body can affect the efficacy of drugs in you. That's why you see a particular drug A can take, B can take the same drug, but it works faster and better on A, and perhaps cures or remedies the situation faster more than B, because people have different body. They have different body the way the body works, system. So that's why these things are not really cast on concrete. It actually depends on the person. That is why it is important to know what drugs are made of and how to put it together. So thank God, Madam Pat said she's already. She's
I work at the
Madam,
depending on individual body chemistry. Yes, I'm with you, ma'am.
Yes. So me, I decided to slow down because I want you to give me the terminologies that is needed, because you are in the body chemistry. Yes. All right. So let's continue. I just hope that time will be friendly, and we need to finish at least second module before tomorrow. So now, distribution 2, drugs are distributed to organs and tissues based on blood flows. Organs with high blood flow, like we talked about, the liver, the kidney, those sensitive aspects of the body, drugs are distributed. But once you take drugs, you don't see, because you cannot see your body, but it does a lot of work inside you. It does a lot of work. It moves around. It's distributed to these organs that have high blood flow, that need blood. So it moves there. So protein binding too, some drugs bind to proteins in the blood. Another aspect that is a bit technical. We have proteins in the blood that binds these drugs. No need to, I don't want to delve extensively into the pharmacy aspect of the thing, of what we are doing, because we are actually not pharmacists, except otherwise, if you don't know. So that is just what we are trying to say. So proteins in the blood now helps to reduce it does a little work. It reduces the availability for distribution to tissue. So if you have protein, that's why sometimes if you have proteins in your system, which everybody has, we have those tiny little
I know why. I think I have a little knowledge of this protein thing.
Good. Go ahead.
These dietitians, they will tell you that when you eat more proteinous food, that it takes time to digest or takes longer for your body system to absorb it than just maybe the carbs and the rest of them.
That's
I think
correct. Thank you. Thank you perfectly. You are just correct. Now, that is true because when you have excess, not excess, but if you have a high protein level in your system, you find out that some of these drugs, when you take them, it tends to stand as small roadblocks. It's like you are traveling. You have to stop at different levels, at different points, maybe checkpoints or so. So it's just like that. You have those small roadblocks that tend to obstruct the real movement of distributing it to your tissues or to the parts of your body that actually need it. Another thing is the brain barrier, the blood-brain barrier that can limit the passage of certain drugs into the central nervous system. That's another very important part, CNS, central nervous system. So now, this blood-brain barrier can limit the passage that's in the brain, the central nervous system. Now, when there are barriers, how do I put this? When there is blood, I don't know how to explain it. This one is real serious medical terminology. But however, just note that in the aspect of distributing this blood to the body, these brain barriers can actually obstruct, and sometimes it can affect the nervous systems. If you have these barriers that can actually maybe hamper the blood flow, to the different tissues in the body, it becomes a problem. Your central nervous system that gives you the stimuli, that stimulates you, that tells you what to do. When you need to do one thing, you need to stand up and use the restroom, you need to do this. Your central nervous system regulates and controls all those things. So that is the distribution aspect. And then we have the metabolism. Excuse me. We have the metabolism, the liver enzymes that metabolize drugs, converting them into, all these ones are, okay. We also have genetic factors too. We also have the drug interactions where the medications can induce or inhibit liver enzymes. Like I said, organs in the body. As a pharmacist in the making, or pharmacy technician, or you work in a pharmacy, it's important for us to take note of these things. When we are administering drugs, up until now, they are trying to see how to, because they keep talking about antibiotics. They keep saying antibiotics. When you take antibiotics, it affects the liver, it affects the kidney, it affects this. Again, medical science has come to know that, or they have come to leverage themselves on the fact that most times when they take this when you are given these antibiotics, they look at the constituents of it and they see that the benefits outweighs the adverse effects. But need for us to know that these drugs are harmful. Drugs are harmful. I have not seen any drug that does not have at least one or two harmful parts or aspects of it. But the fact is, depends on the illness. Sometimes it may have a little percentage of being harmful to you and has a higher percentage of being beneficial to you. So on that premise, they weigh it. That's how doctors do. They weigh it and see and say, okay, since it is more beneficial, I think we can handle the harmful effect. The harmful effect is just going to be very small. So let's give this benefit. Let's this patient take this particular drugs because it will be helpful. The benefits greatly outweighs the side effects or the harmful aspects of it. So they come up with these things. It's important for us to know that our body works, our liver, our kidney, everything we eat does a whole lot of work. So we shouldn't take it for granted. If you are able to maybe walk, if you are able to move your body, you are blood pumps in your body, you are agile, you can move your legs, you can do all these things. Many people take it for granted, but to be very candid, your body has to be in good state in order to be able to deal with the barriers, to be able to handle the way drugs are absorbed, the way drugs are distributed, the way it is metabolized in the body, how it works and is distributed within the tissues. Very important. And then the last but not the least, like we talked about excretion, the kidney, which is a primary organ for drug excretion. It filters drugs. The kidney does a lot of work. It filters drugs. It helps there. So if you see people get a kidney failure because they have issues with their kidney, they are not able, the kidney is not able to function and actually filter drugs, filter waste, let me say so, filter those things that should be filtered away because of a particular illness or a particular challenge. So the liver too, the lungs, these are organs that are very, very fragile, are very, very important to a human being. These 4 organs, the kidney, the liver, the lungs, and other parts too of the body that are very, very delicate is very, very important. Just like the lungs, you can see volatile substances can be excreted through the lungs. Drugs can also be excreted through sweat, saliva, and breast milk. Yes, that's why there's this particular thing that I can use as an illustration to explain this. That is a garlic. We know garlic. I don't know how many people love to eat that thing, garlic. That particular garlic.
Yes,
Are we
yes.
together? Okay, so garlic is one thing that is just like I'm relating it to what we are doing. When somebody eats garlic, I am one person that I run away from garlic. When someone eats garlic, I want to tell you some drugs that can be so powerful that even it can be excreted. You sweat and someone comes close to you, the person will even perceive the drug. Saliva, your saliva falls somewhere, the person will perceive it. That's why I'm relating it to garlic. If you have eaten garlic, you know. If someone eats garlic, even when the person, I used to have a colleague of mine where I work that had some health challenges, so he was advised to take garlic. So he chose, my God, if he takes that garlic and as much as maybe enters a particular place and comes out, even if he entered that place for like 2 hours before you entered, you still perceive that somebody like me, or maybe because I have a strong, you still perceive it. So that is how some of these drugs are. Some through the sweat. If someone eats garlic, saliva, or breast milk, which one is even breast milk? Breast milk doesn't even have to be garlic. Anything you take, it comes out through breast milk. You would actually, that's why pregnant women are advised not to take certain drugs, because if they take it, if the child sucks or the child comes in contact, the baby would be affected. So drugs are very, very powerful. That's the kinetic, pharmacokinetics. That's the kinetic aspect of drugs. Now, we are looking at the dynamics. Quickly, before it is time for us to leave, I just hope we are able to complete this one because we're 30 minutes behind schedule, but let's see how far we'll go. Now, pharmacodynamics, like I said, when I had earlier on explained it, that pharmacodynamics focuses on how these drugs affect the body, how these drugs interact with the body to produce the therapeutic effects. You're taking paracetamol, all the work it does in your body to ensure that you feel less of headache, or you don't have headache at all, or the headache disappears. That's the dynamics of this particular pharmacology. So drugs often act by interacting with specific molecules within the body known as receptors. So there are molecules in your body, like we already talked about. There are proteins in your body, little proteins. There are things in your body that would actually interact with the drugs. Some may stay as stumbling blocks, some may stay to help interact with the drugs. So pharmacodynamics simply talks about that, how these drugs actually give you that relief. I actually give you that therapeutic effect. That's what we are going to look at as fast as possible before our time goes off. Okay, so now, why are we saying all these things? We cannot overemphasize the need for us to learn these things, at least within our own level, before we actually become full pharmacists. That's where you have this training, this particular topics extensively delved into at that higher level. Now, pharmacy technicians, it is important that you understand this pharmacokinetics and the dynamic aspect of pharmacology. Why? Because it ensures appropriate storage, like we talked about, handling and administration of medications, because you know how they are absorbed distributed, metabolized, and excreted. All these things are knowledge that you should have, at least background knowledge, just foundational knowledge that you need to have. Now, also, when you have this knowledge, it would help you because you will counsel patients, it will help you to counsel patients on the factors that may influence drug efficacy. For example, there are times you are given a particular drug and you'll be told, do not take this when you take the drug. Do not take this particular thing when you take the drug, because if you take that thing, it will make it to be less potent. It will interact, thank you, and it will reduce the efficacy of that drug. So these are some of the things that you as a pharmacy technician, you need to know. I know they used to say, up until I just discovered, they used to say, don't take malaria. They've told me several of my children, they will say, don't take malaria drugs. I just listen and smile. They say, don't take malaria drugs and then take multivitamin. Blood medicine, sorry, not multivitamin.
Yeah, not
blood
multivitamin. It's blood.
They'll say, don't take, thank you, don't take malaria drug and then take blood medicine. And they always say that. Now, up until I became like, I used to think, I'll say, that I'm always afraid of taking medication. Somebody would tell me that I should take these strong drugs, maybe if it's antibiotics or something, all those drugs that if you take and you don't eat, it can even daze you. It can daze you very well. You understand? Then somebody will say, don't take it with blood medicine. That one, it means the person wants to kill you. The person just wants you to go, because sometimes they can give you a drug, a strong antibiotic. They say take for 7 days, or they say take for 14 days, or take for 21 days. And then you are busy taking every day, taking this morning, evening for this number of days. And they say, don't allow any blood medicine even come close to you. It's sometimes funny. But over time, I understand why they say so, because there are certain things that when you take some drugs, it tends to lower the efficacy of the medicine that you should take. Just like I gave that illustration of blood medicine, because when you take, it has a way of enhancing your blood. It has a way of bringing antibodies or something that would help to reduce the efficacy of that particular antibiotic that you are taking at that time. So they'll say, finish the antibiotics, and then to equip yourself and to rebuild yourself, now you begin to take the blood medicines. So it's important that even as pharmacy technicians, that we should have at least the background knowledge of some of these things. With time, with practice, with time, with experience, we get to know it better. Also,
just like, excuse me.
Yes, please.
Just like antacid.
Correct.
Even if you are an ulcer patient, when you are taking the ulcer drugs, you don't take it immediately with antacid.
Correct.
If you take it immediately, it will reduce the effect of it.
Wow, thank you.
So because of that, any drug you are taking, either you take your antacid 30 minutes after you take your drug.
That's correct. Thank you so much, madam. Are you sure you are not going to have it? Because I can already see the vision of you having a very big pharmacy, just like Madam Nenna.
No,
if you don't have a pharmacy, think of doing that.
For sure, by God's grace.
Think of doing that. That's what I wish you and Madam Nenna, so that by the time you own the pharmacy.
By God's grace, by God, I'm already working on it.
So that's what we're praying for.
Amen. So that by that time I can call Madam Pat or Madam Nenna and say, please send me just $500 for my, and then you just send. At least you remember that I prophesied. Okay. All right. So that's just it. So let's look at a basic let's see, classifications of drugs for pharmacy technicians, as it's important to understand drug classification. Now, drugs are categorized based on their therapeutic effects, chemical properties, and mechanisms of action. That's to say that there are different categories. Drugs are classified into depending on the effects they have on the patients, healing effects they have on the patient, the properties, their chemical properties, and the mechanisms of action. Okay, so let's get to it. So now, we have different drugs. We have the analgesics. Which is used to relieve pains. Maybe you have pain or something. Yeah, you just take, you'll be advised, take analgesic, take maybe paracetamol, aspirin, ibuprofen. Then we have the antibiotics. Like I keep talking of antibiotics. We take antibiotics, the cleans, tetracycline, ampicillin, the lins, and the lins. We take those ones, antibiotics. And then we have, I can see here, we have the blood pressure control. We have the antihypertensives, the medicines, the drugs that are used to subdue high blood pressure, lower high blood pressure. We have a lot of them, you know, and we have the anti-diabetic drugs too, the blood sugar control, those that help with the insulin level of patients, that help control blood sugar in a diabetic patient. So drugs can be divided into what you have seen, the antihypertensives, the anti-diabetics, the analgesics, and the antibiotics. Okay, we also have other different, other types of drugs, other ways drugs can be classified. We have the antihistamines. Those are allergy drugs, drugs that are taken when you have allergies. Maybe you are itching or sneezing as a result of something, or you have running nose. Obviously, anything that results as a result of a particular, that comes as a result of a particular allergy that you're experiencing. Like we have the loratadine, we have the big names, like cetirizine and
Zytem.
okay, those are big terminologies. So let's move. Now we get to antidepressants too. We have mood stabilizers that are used to treat depression and other mood disorders. For those that have mental health issues, you know, most times they have drugs like this, fluoxetine. I remember that one that is take for issues of maybe depression when someone is seriously depressed, is to help treat depression and stabilize the person's mood. Very important. We have the blood thinners too. They are drugs that are called anticoagulants. They are drugs that help to thin the blood. In case you have issues of blood clot, your blood clotting, or patients with blood clots, you know, in the body. Sometimes they give it to people that used to have maybe miscarriages that have clots of blood. So they help to thin the blood. Those are anticoagulants, help to make the blood to, you know, to sieve out the clotting, and then it comes out normally. So these are some classifications on ways drugs can be classified. Okay, we also have some drugs, controlled substances. Already from the word, we know that there are drugs that are highly controlled, especially outside. In Nigeria, anything goes, you know. Most things can just go under the carpet in Nigeria, but outside, it's not easy. These drugs are actually controlled because they can be misused. They have the potential of abuse. People can abuse them, can use them wrongly, which will result into abuse. Now, it's important that we understand this classification so that it can help us as pharmacists to handle these medications appropriately. When you have those controlled substances, those drugs that are not supposed to be taken except they are prescribed by specialists in that field. For instance, sometimes, even though they are abuse drugs, like we have, controlled drugs, there are some controlled drugs that are given for certain reasons, and they are monitored. The dosage is given, and it is given for a particular purpose. You don't just get it in any pharmacy. You don't just walk into any chemist and say you want that kind of drug. You'll be arrested, except you have a legal backing. Prescription and a legal backing that you are supposed to take that drug, or else you explain and you will not be able to explain again why you want to buy those drugs. So they are actually controlled. Illegal drugs, in as much as they are illegal, they are used sometimes. You find out that, let me give you an illustration. One of the times I had to, in the course of visiting someone, I was actually going my rounds. I went to see someone in an insane asylum where they keep people that have mental illness, like have I don't want to say mad, because mad is not the right word, but they have issues. So they are confined there in an insane asylum. They are kept there. So I had to go. So in the course of me discussing with the lady there that I met there, first and foremost, the psychiatrist. I did not even see the psychiatrist yet. I was just in the front. So I was like talking, and she was trying to tell me that Yes, that one that is shouting, one of them was inside. That one that is shouting said she needed drugs, that he was going to. In fact, when they went to him, it was as if he was going to just die. He was just going to give up because he has already abused these drugs and it has become a part of him. So it will surprise you to know that even as he was abusing heroin, he was abusing, taking all those things, they did not outrightly stop him from taking it. Like cut him off, just cut him off like that. No. They had to give him a controlled measure. That's why I had to bring it here. They had to give him a controlled measure, small, with therapy gradually to ensure that he gradually detaches from it and from the influence of that particular drug. So these drugs are useful drugs, not that they are not useful. They are useful drugs, but they are only controlled because they have the tendency of being abused. That's why it falls under the control aspect, falls under controlled substances. Now let us see some of these controlled drugs. Now, according to how it is rated, we have the Schedule 1, C to I, we have the Schedule 2, we have like that. Now, Schedule 1 are drugs with no currently accepted medical use and a high potential for abuse. Maybe there is no use for it in the medical world, let me say so. Excuse me. There's no use for it. So if it is left, people will misuse it. It will be taken for the wrong reasons. That's why it is controlled substance and it falls under Schedule 1 because it has no currently accepted medical use. And these drugs are not prescribed in a medical setting because it has no use. They have no use for it. Patients have no use for it. That is Schedule 1. Now, Schedule 2 are drugs with high potentials for abuse, but with accepted medical uses. Remember, there are some drugs, I want you to understand, there are some drugs that, though they have, like I talked about the first time, though they have a high potential for abuse, but they can be given to the patient with accepted medical, that's a medical consent, or they have sat down to, okay, this drug can be given to the patient only on prescription, only on monitoring, only on supervision. Should this drug be given to the patient? Like we have the oxycodone, we have morphine, we have methadone, we have a lot of these drugs that are actually in Schedule 2 that intermittently doctors can, depending on the illness, for psychological reasons or for physical dependence or for a whole lot of things, people tend to misuse these drugs, but doctors can actually give to help in the medical aspect, maybe to help the patients get better in the line of care. Now, strict regulations are in place for prescribing, dispensing, and handling this medication. These ones that I've just, this Schedule 2 that I've just finished talking about. So pharmacy technicians must ensure that all documentation is accurate and up to date. Why am I emphasizing this? As a pharmacy technician, ignorance is not an excuse. That's why we are learning. So you can be in a pharmacy where there is this controlled substance and somebody walks in to get it, without a prescription or even with a fake prescription or whatever. There are certain documents there are certain things that you need to see before you can. And as a pharmacy technician, like I say, you cannot administer any drug. You can't give anybody anything without the consent of the pharmacist. He has to see, he has to stamp. Let me use that word. He has to stamp on it before you can actually give these drugs. And you must document them. Ensure that documentation is accurate and up to date. Do not omit anyone. Do not miss anyone, so that in case of anything, you'll be able to know how to go about it and what to say. We also have Schedule 3 too. Let's see, this thing is covering my view. Okay. We also have Schedule 3, drugs with moderate to low rates or low potential for physical and psychological dependence. There are some drugs like that. They have moderate, low rates for physical and psychological dependence. Now, products containing less than 90 milligrams of codeine per dosage. Now, we have some cough syrups. We have some cough syrups that fall under this Schedule 3. Now, they have moderate to low potential for physical and psychological dependence. Some cough medicines, some cough syrups are abused. They're abused because they can be used for the wrong reasons. Some of these cough syrups, some contain this codeine that we are talking about, at least 90 milligrams of this codeine. Now, pharmacy technicians should be aware of the quantity, the limits, and documentation requirements for these drugs. Very important. So you see that you work hand in hand with a pharmacist, because all these things that I'm telling you, I'm just telling in on the surface. A pharmacist has a grounded knowledge of it because of the level he or she is. Very important. Okay, so, and then we have Schedule 4 with low potential for abuse and low risk of independence. Our time is moving. Now, these medications are still controlled, but with fewer restrictions, fewer compared to 2 and 3. They are still controlled, but there are fewer restrictions. That's tramadol. Okay, like tramadol, you can see the tramadol, you know, it's a drug. It's a drug, but sometimes it has the potential of abuse. People abuse tramadol, you understand? And if not properly guarded against, we have adverse effects. We've been hearing somebody swallowing so kilograms of tramadol and all those things, but they are not as, the measures on them are not as stringent as 2 and 3. They're not as authorities regulated or clamped down as 2 and 3. So this is just for us to note. So in any overly in any of these levels, we should understand how, when, the quantity, whether it is right or not, see the prescriptions and ascertain before we give. Now we have the last but not the least, which is the Schedule 5. Now these are drugs with let me drink some water. Why did it move? Don't move to anywhere, please. Now, these are drugs with the lowest potential for abuse. They are drugs with the lowest potential for abuse and limited quantities of certain narcotics. It depends on their ratings. There are certain narcotics that are actually not as harmful as others. Cough preparations containing 200 milligrams. Remember, the other one didn't have this high amount of milligrams of codeine in it. So you see that the more codeine is contained in a particular drug, the more it goes against my daughter. So these drugs have the fewest restrictions, but still require proper documentation. So overly, holistically, drugs require documentation. The drugs you give, make sure it is documented. Make sure that you have good record while the person is taking it, what is the dosage the person needs to take, and so on and so forth. This is very, very important for us to know. Okay, we still have, let's see how many, sorry, let me just see how many we have to go before we move to the next slide. Okay, we have a few. I just wanted us to check. I crave your indulgence. That means we can run down drug nomenclature. Okay. Just wanted to know. I promise not to take anybody exceeding the time. All right, so now we want to look at nomenclature of drugs. What is drug nomenclature? Very, very important for us to note. Okay, what do we mean by nomenclature now? As pharmacy technicians, it is important that we understand the formation of drugs, nomenclature, to ensure the correct identification, handling, and dispensing of these drugs that we are talking about. All right, so excuse me. Okay, so now drugs are typically referred to by 3 names. We have 3 names that we talk about drugs. How do we name drugs? How do we nomenclature how drugs are named? Very important, the constituents and how they are named. There are different ways that drugs are named. We have the generic names for drugs, we have the brand names, and we have the chemical names. We have 3 different ways that we can name our drugs. Now, what do we mean by the brand? We are going to look at them one after the other briefly before we call it a day. Now, this is drug nomenclature. Sorry, the R went out. I think it traveled. There's supposed to be an R. I did not check it. Let me, sorry. Sorry. Just give me, let's see how to do something. Okay. It's giving me headache. So pardon me. It's just a mistake in the spelling. I'm going to put the R. Let's go ahead. So drug nomenclature, I'm trying to put it, it's not going. Talks about how to name drugs, like we said, the naming system used to identify medications. What is the naming system? Now, understanding this naming system as a healthcare practitioner, it is important that you understand it so that you can communicate clearly about drugs. Now, let's look at the chemical name. 3 ways. We have the chemical name, we have the generic name, and we have the brand name. 3 different names. Okay. Now, the chemical name is the scientific name. Now we are going science a little. The scientific name that describes the chemical structure of the drug. Every drug has its major chemical constituents. That's the major constituent that is higher in that particular drug. I don't know how to. I think I'm just going to bring it down so we can understand. Now, the scientific name that describes the chemical structure of the drug. It's usually long and complex, reflecting the specific arrangement of atoms in the molecules. So chemical names, like we already said, most chemical names are very, very long. Blah, 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 blah. They have it's just like in the school days, we used to have botanical names. For rice, you hear rice, Oryza sativa, you hear this one and this and that, different types of rice. So, but this, we don't call this botanical. Instead, we say chemical names because they are the names that they describe the structure of that drug, the chemical structure of that particular drug and the atoms in the molecule of the drugs, how the atoms are arranged in each molecule. Okay, now we also have, for example, let me give you an example of this chemical I'm talking about. Now, the chemical name for aspirin is a very long name. The chemical name for aspirin is very, very long. Acetyl salicylic. That's the chemical name of aspirin. Now, this name tells you exactly what the drug is made of and how it is structured. That's why it is referred to as the chemical name. Then we have the non-proprietary name. That's the generic name. The generic name is a simpler name. It's simpler, that is used to identify a drug. Excuse me. Is used to identify a drug without branding that drug. It is the official name given to the active ingredient and it is protected, and it is not, I beg your pardon, it is not protected by trademark. It's not protected by any trademark. It is, again, I repeat, it is a name that is used to identify a drug without it being branded. For example, the generic name for aspirin is simply the same aspirin. It's not branded. That's the generic name. Why? Because it identifies, it's the ingredient that is in that drug. Aspirin is a tiny ingredient that is actually used to make up that, to form that aspirin drug. Okay, and then the last but not the least is the brand name. The brand name, we already know, brand ambassador of a group, brand this, brand that. What is the brand name? Is the name given to a drug by its manufacturer. That's the name that you get to see. The name given to it by its manufacturer. For example, different companies can, thank you. Thank you so much. Thank you. I mean, this training means tomorrow we are going to be doing it together. We are just going to be doing it together. Maybe you'll be training me and I'm training you. That's how we are just going to, that's how we'll do it together, because they are very knowledgeable people on this platform right now. So thank you for that, M&B. So for instance, like aspirin that is used, several brands. I like to talk about aspirin a lot because it's small and I can just take it, under several brand names. Like you said, M&B. We also have the aspirin. We have the Bayer aspirin. We have different types of aspirin. It is known with its brand name, M&B. And all that, yes. So this brand name is specific to the company that markets it. Very important. So summarily, everything I've just been talking about is what we have talked about, is what you are going to see in the slides that follow. So summary of the differences is this. I just want to give a brief summary of the differences. Chemical name describes the drug's chemical structure. Like I talked about acetylsalicin. I talked about that. Acid. I talked about like we talked about M&B branded name,
which is Emprim. M&B own is Emprim.
You see the name, that's Emprim. Good. You see,
Yeah.
you know why you are getting the names, because you are actually in the forefront of selling, maybe disseminating this drug. Me, I am not in the forefront, but you are very correct. They have different companies that do this, Emzor, like Emzor paracetamol, and so on and so forth. Now, now, why does this matter? Generic drugs are often cheaper. Naturally, generic drugs are often cheaper than brand name drugs. It's just a normal thing. They are cheaper than, and but they contain the same active ingredients and they work the same way. They do the same thing, but they are cheaper than the branded names are more expensive. Generic ones are cheaper. So understanding drug nomenclature, their generic names and their brand names, helps patients and healthcare providers to communicate more effectively about medications, ensuring safe and effective treatment. Very, very important. So these names are used interchangeably. Sorry, let me drink water. Okay, these names are used interchangeably, but there are key differences that pharmacy technicians need to understand. We've already talked about the generic name. We've talked about the difference between it, but nevertheless, it's still here. The slides will get to you. You'll get the slides and then further take time to read what we have talked about. But overlay is the same thing. Generic names are often more difficult to pronounce and are derived from the chemical structure or function of the drug. Generic name of a common pain reliever, like we have ibuprofen, it does the same thing. Ibuprofen does the same. Paracetamol does its own. Aspirin and all those, they are all analgesics. Okay, so we also have the brand name too, that is given by companies, by these pharmaceutical companies that produce these drugs, like the M&B you talked about, like the Emprim you talked about, and so on and so forth. All these drugs have their brand names, different names. Sometimes, like you can see, ibuprofen is sold under several brand names like Advil or Motrin differently. So people that know it, even if
Bustan,
with pardon,
Ibutan, Bustan,
it means you.
Ibutan.
Okay, thank you. It's like you like to take drugs. Me, I'm not a fan of drugs. I'm not a
No,
fan of tablets. So,
it's because I'm there.
yes, that's why you are saying it. I'm not a fan of even the smell, but I do a lot of trainings, because I actually have advanced trainings in it. But tell me to take drugs now. I just don't want to be a doctor that will say do as I say, but don't do as I do.
Yes, I understand.
So don't do as I do, just do as I say. So we also have the chemical name, which
Sorry,
are
ma.
yes, please. Yes, please.
Okay. For instance, the ibuprofen you mentioned now, can you
Yes.
just give me an instance? That's ibuprofen, that's the generic name, the brand name, and the chemical name. That's just using ibuprofen as an example now, so that it will help me understand it better.
Okay.
Hmm.
Fine. Now, having talked about the different names, okay, maybe I should pause, since we have a person that is actually in the selling of the drugs. Maybe let me throw it to her, because she will know the names than me now. Just giving you the example, because she sells these drugs firsthand. So, Madam Pat, the floor is open. Use ibuprofen, because you'll be mentioning different brands of medicine.
Well,
So let's go.
For the ibuprofen, that's Bustan N.
Okay.
It's a brand name.
Okay, that's another company, correct?
Yes. We have some that call their own Ibucap. That is the brand name. It's still ibuprofen.
Correct. Mm-hmm.
Do you get it now?
Yes, I do. That's the generic name.
Yes.
I think that's the brand name. Sorry, that's the brand name.
The brand name,
The brand name is
Mhm.
that
The brand
Bustan N
Yes.
or Ibucap, but the name itself is
Mhm.
ibuprofen.
Good.
Okay.
Which is the
So
How about the chemical name?
the chemical
the
name,
generic.
for example, that's why I said that the chemical name is very long. As you can see, are you on the slide now? Are you on the slide? Okay, you can
I'm
see
on the
if you
slide.
want to call that name. Now you would see, look at it even there. They say the chemical name of ibuprofen is 2,4 isobutylphenyline, whether it's phenyline or whatever,
Yes.
propanoic acid.
That's
Now
propanoic
that
acid.
propanoic acid is the chemical, is telling you the very constituents of that ibuprofen, the active ingredient that was used in making that ibuprofen. You understand? So that is the chemical name. Then the brand name, excuse me, the brand name is what Madam Pat had talked about, all those names, Emstan and all those drugs.
Okay, okay.
Names. So that is practically the difference. So,
So paracetamol is this other one. Generic name is paracetamol.
For that paracetamol.
Is the generic name. Okay, after what? Hello?
Hello?
Really? Yeah, I've seen it here. Acetaminophen. I've seen something like that.
Okay, so you see, the thing is, what we should understand is the brand name is very, very is easier for us to just get it. What do I mean? It's easier for us to get the brand name than the chemical name. For us, it's not like you can see there's a place they say pharmacy technicians do not typically need to memorize chemical names. Understanding their role in identifying the molecular basis of drugs can be useful, especially when dealing with new experimental drugs. Because if you go to look at the chemical constituents of most of these drugs, and you want to know their chemical names, it's going to be very, very advanced. But for pharmacy technicians, if you know the brand name and you know the generic name, I think that is just fine for you to be able to actually judiciously carry out your work efficiently. Because if you go to now start sorting them based on their chemical names or based on the constituents, okay, this one has this one does not have this. It's the pharmacists that will actually maybe do that, or you take an additional training on pharmacology. That's to really delve into knowing these brands of names to help you do your work better. But on the surface, for a pharmacy technician, you don't. That's why it's even here. You don't really need to go and memorize these names. It's very so. This one is even very short. There are some that you cannot memorize, no matter how hard you try. So I think 9:08. Okay, is that okay? Can we move? We'll soon be done. We just have 2 slides to go.
Yes, I'm okay with it. Yeah, I'm okay. I'm fine.
Thank you. So we have key considerations for pharmacy. Or I'm coming. This thing is always trying to stay.
Oh, sorry, I forgot. Thank you, Pat. Thank you. You'll be very, very, very beneficial to us.
I'm only jealous. I'm only jealous that you are telling Pat, thank you. You didn't tell me thank you.
Oh, sorry.
Thank you, madam.
Oh, I was only teasing you. Thank you. You see, that's why I needed to know if we have someone that has that knowledge, so that when we are talking, the person will talk, because I made sure that I will not do all the talking on my own, and someone that is practically involved in the day-to-day dispensing of drugs, know these things, to be there for you to just give the name at first hand. So thank you too, Madam Pat. So how drugs are classified help technicians understand the effects of medications. We've already talked about that, and then their potential side effects. It can also help you with to organize inventory, help technicians organize inventory, dispense medications, and assist with patient counseling. Very important. But overly, the most important thing is you do not work on your own. You work with the pharmacist. That's what you should understand. So that most of like all these chemical names, all these, a pharmacist will really know the constituents of each drug. For example, maybe if somebody says he used to have high blood pressure, there are certain kinds of drugs the person should not take. So if for any reason there's even a prescription from whoever, someone that is not doing his or her job well, and it gets to the farmer, and you see that, oh, this person actually has a high blood pressure, and the person has a history of having high blood pressure, and the person is asked to take this drug, you seek to know why. You have to refer that person to the pharmacist, where the members of the team will work together to see how best, or whether it's actually a good idea for a person to take that drug. So you work more on the reporting role, you work more on the being vigilant, you work more on the inventory, making sure inventory, on the administrative aspect of it, and then learning everything you can learn as you go, because eventually you may not want to end as a pharmacy technician. You may wish to move ahead and continue. So that being said, I think we have actually done justice to the first two modules. By the grace of God, tomorrow is going to be, I was thinking we'll get into that one, but since we are already here today is the first day we had that time lapse, because if we didn't have that time lapse, we should have at least finished
Third module, is it much?
It's calculation. Let me give you an idea of it. This is it, pharmacy calculations, where we will have to look at how the arithmetic do addition, subtraction, multiplication, depending on the number of doses, the number of times, and so on. So it's quite much. So I think tomorrow, because right now we are at towards the end of so we are actually getting to our limit of, so let's rest, because this is calculation. So tomorrow, this will be the first module. When we come, we'll calculate the teaspoon, tablespoon, milligrams, and everything. We'll do that. That's why we have the calculator there. So that being said, thank you so much. I want to appreciate you, both of you, Madam Pat and Madam Nenna. It's really nice to have you. Thank you for all the contributions. Thank you for everything, because
thank you so much.
I appreciate you greatly.
Welcome.
I appreciate
You just have
you.
to
Always
not
detailed in
paying
your
me.
teaching and well explanatory.
Madam
I give
Nenna.
it to Madam Authority. You're too much.
Thank you, because you have attended my class, Madam. The only thing is, pharmacy technician doesn't have too much to talk about. That's why I don't like. It doesn't have too much that are stories and too many things to talk about. But the ones I've had, I guess, the ones you have passed through me, you realize that I can
Yes,
really, yeah.
yes,
Thank you.
yes.
Thank you
You're
so
meant
very
for this job. Yeah, well
much.
done.
I appreciate every one of you
Thank you so
for
much.
being so patient, and the very lovely attitude of Madam Pat to have waited. I've had trainings whereby people don't really have patience towards, waiting. They're just like, oh, this is the time we should start. We shouldn't, why didn't the person and all that? So, but you really exhibited one very beautiful virtue
Do you
today.
know my name is Patience?
That's why. Okay, patience and Pat. I asked if Nenna can attest to it. I asked what that PAT was for.
Yes, I was
actually,
responding, but
Yes,
you
she said
weren't
she was
hearing me.
hearing, but she couldn't talk.
okay, because I was like Patricia, because most people that are Patricia always say Pat. I rarely hear patients that will say Pat, so I was like, maybe it's Patricia. But all
It's
the
just that
same,
I don't like being, I prefer to be addressed as a part than
okay.
patient.
That's beautiful. Thank you so much, Madam Nenna and
You're
Madam
welcome.
Thank
Patient.
you.
Have
You're
a
welcome.
beautiful
Thank
night
you.
rest.
Thank you.
Over to MJB Management and Integrated Services. We've ended for today.
Thank you.
All right, thank you. Thank you so much, Doctor. Thank you so much. Thank you so much for the first day. This is the first day. I believe tomorrow we are not going to spend time like the way we spent our time wasted and waited for us to join. And I believe tomorrow will be early. Tomorrow is 10 a.m. I believe it will be early tomorrow. I appreciate everybody, Madam Nenna, Madam Pat, and everybody that took part into this class. Good night, everybody. We'll meet again tomorrow.
Bye-bye. Good night.
Bye.
Bye.
Bye.